Our regular meeting. So welcome to tonight's City Council meeting. Council members are attending this meeting remotely by video conference. Tonight's meeting is available to the public on Channel 8 and through live streaming on Broomfield's website. Public participation is encouraged by calling 855-695-3744 and pressing *3 to be placed in the queue for comment. Please note, if you would like to speak on more than one item on tonight's agenda, you will need to press *3 each time to be placed back in the queue for comment. Public comment will be limited to 90 minutes total per item. The first 1 to 15 participants in the queue will get 3 minutes to speak. The next 16 to 25 participants in the queue have 2 minutes to speak, and the time remains. The remaining participants will have 1.5 minutes until 90 minutes expires. Again, the number is 855-695-3744 and press *3 to be placed in the queue. Screeners will ask callers for their first and last name, neighborhood, and the agenda item the caller would like to comment on. Please call several minutes before the agenda item, and don't forget to press *3 to ensure you are in the queue for comment. Public comment will also be taken during the public comment section for topics not on tonight's agenda using the process previously outlined. Again, the number is 855-695-3744 and press *3 to be placed in the queue. The City Council meeting is called to order. Will the clerk please call the roll?
Anderson.
Here.
Castriata.
Here.
Broom.
Here.
Hinkle.
Here.
Jezierski.
Here.
Law Evans.
Here.
Lim.
Here.
Lindstedt.
Here.
Schaff.
Here.
Tessier.
Okay.
Tessier.
See her. I don't see her. So a quorum is present. Will everyone please rise and join me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States
of
America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Again, in an effort to keep order for tonight's meeting, I'll ask council to please utilize the video conferencing tools to raise their hand for comment, or when making a motion or a second. I will call on the first hand raised to state the motion and the second hand raised to make the second as appropriate. I ask council members to limit their comments to 5 minutes. Abby will be assisting with the timekeeping and will provide council members with a notification via video conferencing chat when 1 minute remains. Please ensure you are on mute when not speaking. If council member needs to leave the meeting, please inform me before doing so. We will plan on a 10-minute break at approximately 8 p.m. We will begin with council review and approval of this evening's agenda. Council may add or remove items to the consent agenda, or council may revise the order of business for the meeting. Does any member of the council have any comments or questions regarding this evening's agenda? Raise your hand. Noting none, the agenda will stay as published. There are no items for council's review this evening under petitions and communications. We will move to public comments next. This is an opportunity for the public to comment on matters other than the items already listed on this evening's agenda. To be placed in the queue for comment, please call 855-695-3744 and press *3. Public comments will be limited to 3 minutes. The only person that's in the queue right now is 411B. So we'll go ahead and, I'll keep an eye open for public comments, as will the Mayor Pro Tem. And we'll move on to council's community and event updates are next. Does any member of the council have an update this evening? Councilmember Lim.
Through my assignment to the Workforce Center, I wanted to make residents aware of the opportunity that there is a statewide virtual job fair tomorrow from 10 a.m. to 4 p.m. You need to register for it, but it will have available part and full-time jobs throughout the state, which would include local jobs and remote jobs. If you would like more information, call the work center, our work center, first thing in the morning at 303-464-5855. Thanks.
Thank you, Jean. Mayor Pro Tem?
Thank you very much, Mayor. I just wanted to let everyone know about the Ball Swan Ball this Saturday. The City and County of Broomfield is proud to be one of the sponsors, and you can still register. It's free to attend at ballswan.org. It's Saturday, February 27th, starting at 6:30. Thank you.
Thank you, Councilmember Schaaf.
Thank you, Mayor. So I just wanted to let everybody know that, well, first of all, a huge thanks to staff for this. Yesterday, CCAT hosted a transportation forum, hosting the governor, the CDOT director, as well as the Speaker of the House and the Majority Leader and the President, as well as the President of the Senate. And it was a great conversation regarding transportation. Broomfield hosted that Zoom call for on behalf of CCAT. There were many of the organizations that we are a part of, CCI, CML, CCAT, and Metro Mayors, Northwest Mayors and Commissioners. So many organizations were a part of that call. It was a statewide conversation regarding transportation. Broomfield was there, hosting that call. So kudos to staff on hosting that. Really came through. It was a great conversation. Hopefully we'll see the fruits of that in the short period of time when that transportation bill is dropped. So thank you again, staff.
Thank you. I'm not noting any other. I'll make a comment. Then on Thursday evening, we will be having a community conversation town hall. My notes doesn't include it, but it's going to be featured with Chief Krieger talking about the crime numbers in Broomfield, which are up right now. We'll spend less time on COVID because we are dedicating some time on COVID tonight. And so Chief Krieger will talk about the issues facing Broomfield Police and community on an increase in crime. So that's at 7 p.m. And for more information, you can find that at broomfield.org/calendar. Council's consideration of the consent agenda is next. We will review this evening's consent agenda in two parts, as item 7E is a request for an executive session and requires an individual motion. Following the clerk's reading of consent agenda items 7A through 7D, we will ask for public comments. Will the clerk please read items 7A, 7B, 7C, and 7D by title?
7A, approval of minutes, regular meeting of February 9, 2021, council meeting, and the February 11, 2021 special meeting. 7B, resolution number 2021-34, authorizing and approving an intergovernmental agreement between Adams County, Colorado Legal Services, the cities of Westminster, Thornton, Federal Heights, Brighton, Commerce City, Aurora, and the City and County of Broomfield regarding contributions toward a landlord-tenant legal services pilot program. 7C, resolution number 2021-33, authorizing and approving an agreement by and between the City and County of Broomfield and Concrete Express, Inc. for the safety improvements on West 136th Avenue between Tejon Street and west entrance to Legacy High School. Resolution number 2021-40, adopting the First Amendment to the City and County of Broomfield budget for the year of 2021. And 7D, resolution number 2021-35, authorizing and approving an intergovernmental agreement by and between the City and County of Broomfield and the Adams 5-Star Schools for the use of recreational facilities.
Thank you. We will now proceed with public comment. Does any member of the public have comments on this agenda item? Please press *3 and state your first and last name and neighborhood for the record. Once again, I'm not noting anybody that's for comments tonight other than for 11B. So we will move on to council member comments on this agenda items. Any member of council have any comments? Councilmember Schaaf.
Thank you, Mayor. I just wanted to point out for our public, item 7C is kind of a long time coming. That intersection there at Zuni and 136 is treacherous. to say the least. So I'm very happy that we are going to be making some advancements there for not only that intersection, but also the safety there for the students at Legacy. So this was a project that I first saw. I think it was one of the first projects I saw when I got on council 3 years ago. So I'm glad to see that this is coming to fruition and that project will be moving ahead. So I look forward to supporting that tonight. Thank you, Mayor.
Councilmember Law Evans.
Thank you, Mayor. So I have a question or a confirmation maybe on item 7B, as in beta, the landlord tenant legal services pilot program. Just to confirm with staff, that is not the same as the ombudsman position that I think we approved and is in the 2021 budget. Is that correct?
That is correct.
And can we get a 2-sentence update on where the ombudsman situation stands, as it were?
Yes, you certainly can, Councilmember Law Evans. Would it be possible for us to check in with HR
Of course,
quickly to see what the status is, and then I'll send it back out to you?
Sure, of course. Very good. Thank you. That's all I have.
Okay, any other questions or comments from council? Is there a motion that the recommendations contained in the staff reports for agenda items 7A, 7B, 7C, and 7D be approved? Councilmember Schaaf.
So moved.
Is there a second? Mayor Pro Tem.
Second.
Any discussion? Will the clerk please call the roll?
Anderson? Sorry. Anderson?
Yes.
Castriata?
Yes.
Groom?
Yes.
Hinkle?
Yes.
Jaworski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
Yes.
It passes unanimously. So we'll move on to item 7E, which is request for an executive session on March 2nd. Okay. So it says here we'll now proceed with public comments, but don't we need to have the resolution read?
We do, Mr. Mayor. I can read that now.
Okay.
That an executive session be held on March 2nd, 2021 at 6 p.m. for the purpose of legal advice regarding reverse setbacks as permitted by section 24.6.402.4b of the Colorado Revised Statutes.
Okay, so we'll now proceed with public comments. If there's anyone who would like to be heard, please press *3. State your first and last name and neighborhood for the record. And once again, I'm not noting anybody other than a person for 11B. So we'll go to council comments or questions. Does any member of council have comments or questions? Raise your hand. You'll be identified. Recognized. Okay. Requests for an executive session require an affirmative vote of 2/3 of the members present. Will the city? Well, I've already had to read the recommended motions, but it seemed to me that we had to have that read before we did public comments, or so there need to be so we've already read the motion. So
We do still need a motion,
Okay.
Mr. Mayor.
Okay, so then will you read the recommended motion then? Well, I mean, I'll call for a motion based on what you just said, right? Is there a motion?
Yes.
Okay. Mayor Pro Tem,
So moved.
is there a second? Councilmember Schaaf.
Second.
Any discussion? Okay, will the clerk please call the roll?
Castriata?
Yes.
Groom?
Yes.
Hinkle?
Yes.
Jaworski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Schaff,
Yes.
Anderson.
Yes.
It passes unanimously. And so we will move on to, well, there is, first of all, note that there's no business before the Board of Social Services. And we'll have our COVID-19 update this evening. We have a COVID-19 update for the Board of Health's review. The meeting of the Board of Health is called to order. The clerk, please call the roll.
Anderson,
Here.
Castriata,
Here.
Groom,
Here.
Hinkle,
Here.
Jaworski,
Here.
Law Evans,
Here.
Lim,
Here.
Lindstedt,
Here.
Schaff,
Here.
Tessier.
She's still not, she's still not here. So it passes unanimously. So the meeting of the, well, a quorum is present. I was looking to see if Sharon was on the line. A quorum is present. Board members have a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Good evening. Jason Volling, Director of Public Health, will give us a brief introduction, but of course we are all well versed with COVID-19, and Jason's going to provide us an update. Jason?
Yeah, thanks, Ms. Hoffman, and good evening, Mayor and Council members. As we did last week, I mentioned we provide an in-depth update to City Council on Mondays, and those are recorded along with our slides that are available, so the public can go there and see the in-depth update. A couple of key highlights I wanted to hit is, as of yesterday, Broomfield moved to level blue. This is great news, and it's due to the work of our residents of really adhering to those public health measures. So I want to do a big shout out and thank you to the residents. What does it mean? For personal gatherings, it's 10 people or up to 2 households. For restaurants, they can now operate at 50% capacity up to 175 people indoors, or 225 for large venues. The last call has been moved to midnight. Indoor events are 50% capacity up to 175 people. Outdoor events, 50% capacity up to 250 people. Organized sports, 50 athletes or fewer per activity. And then gyms and indoor recreation, 50% capacity or 175 people, whichever is less. So that's great news. One thing I do want to know is under the current public health order, the back to business certified businesses still have to operate at level blue. They cannot operate under level green restrictions. The advantage of staying as a back to business, a certified business, is both letting the public know that you've taken those additional safety precautions, but also if we ever moved back to level yellow, being able to operate at that lower capacity limit. Regarding epidemiology and what's happening as far as trends, I'm sure most of you have heard of the B117 variant, otherwise known as the UK variant. We've had 3 cases of that variant verified here in Broomfield to date. What we know from the CDC is this variant is doubling every 10 days. And so the CDC believes that there could be more than 50% of the cases of this variant circulating in the US by mid-March. So what does that mean? It means that we have to vaccinate our vulnerable populations as quickly as possible and keep our cases down. So if the variant does become the dominant strain and we see an increase in cases, it doesn't get to the point where it impacts our hospital system. As far as vaccine distribution, Broomfield's doing great. We've administered over 17,835 doses, while we've only received over 8,000 doses. So that's good to see that our residents are getting their vaccinations, both here in Broomfield, but in other locations. More importantly, we're leading the Denver metro region in the percent of 70-year-olds and plus that have been vaccinated. We've vaccinated at least 78% of our 70-plus population that have received one dose. And we're making great strides with the 65 to 69-year-old residents, with 43% being vaccinated. I think one thing we emphasized on yesterday's session is that we all realize the sign up and appointment process can be a little bit complicated. And we understand if you, again, there are people that are looking at multiple sites to register and sign up, also being on a certain wait list and waiting for their number to be called. So again, the reminder to the general public is you don't have to go only through your healthcare system. You can sign up. All of the phase 1 providers that are providing vaccines are listed on the state website. We also have a link on our website to them, and they have a website, but also a phone number if you need to call. And then lastly, our Back to Business program. We have certified 54 applicants, or I should say we have 54 applications. 48 have been approved businesses, and then we have 6 that are approved for inspections. And with that, that concludes my presentation, and I'm happy to take questions.
Thank you, Jason. We'll go to public comments. If there's anybody who would like to be heard or has, please press R3, state your first, last name, and neighborhood for the record. Once again, I'm not noting anybody on the screen, so we'll go to the board. Questions of the board are next. Does any member of the board have any comments or questions? Councilmember Lim.
Yes, there was an announcement from the White House today that the states would be getting a sizable increase in the number of doses. And what we talked about yesterday, I know, was that, if we in Broomfield had extra doses available, that we would make efforts to vaccinate more of that 65 to 69 population. So do you see that announcement from the federal level of the increase in doses positively impacting our local effort to do vaccinations?
Yeah, Councilmember Lim, as I mentioned yesterday, we got a commitment from the state to see increase vaccine supply coming specifically to Broomfield, which is good news because UC Health isn't administering any vaccines directly in our county, and they're our one major health system. Secondly, with the White House announcing this, and also with Johnson & Johnson expected to come online at the end of February and beginning of March, we are expecting to see an increase in vaccine supply. We don't know exactly what that's going to mean for the state, but the state is now using a formula that includes county population for vaccine distribution. And in Broomfield, we're scaling our team up to be prepared. So as we receive more vaccines, we can get those out. And one thing I would also encourage is we have our vaccine interest form. So again, if you're one of those eligible populations, please sign up on that vaccine information form. We use it. We also share it with our pharmacy partners and phase 1 providers.
Okay, I had one follow-up question to that. When you say that UC Health is not vaccinating in Broomfield, does that mean they're not vaccinating Broomfield residents anywhere or just not at their Broomfield locations? I just wanted to clarify that.
Just not at the Broomfield location. They are vaccinating, as is every other health system Broomfield residents.
Okay, thank you.
Councilmember Groom, or Board Member Groom.
Thank you. I was wondering if you could put up the first slide or the dial. I didn't know if you had the dial with you on a slide tonight. I just wanted to make a clarification for everybody in what the restaurants can and can't do in the back to business. So they can't, the first bullet, it said it can't go below green, right? So we're in blue, they can operate in green, but they can't go below green.
No.
Or they
actually,
can't be in green.
They cannot be in green.
Okay,
and
because I think that first bullet misled me to think they can't go below green, but they could be in green. So maybe I read it wrong as I was trying to read it. So they can be in blue, and we are in blue. But the back to business says you can be where you're at -1, but once we're in blue, you cannot be -1. So you cannot be in green. All
That's
right,
correct.
thank you for the clarity. It must have been me misunderstanding. Thank you.
You're welcome.
Oh, I'm sorry. I did have one more question. Any updates on BBST and what they're doing? Because that is a lot of emails that we're getting right now.
I realize that. I believe there will be an announcement being made tonight on their plans. I don't have the final plans that have been shared with me, but I do believe they're looking very closely at middle school and high school, bringing them back similar to Adams County.
And where is Boulder County on the dial? Do you know?
I believe Boulder County is still in level yellow.
Okay. Thank you very much. I appreciate it.
You're welcome.
Okay. Okay, it's kind of strange. I saw Councilmember Schaaf's or Board Member Schaaf's hand up, but it didn't show up here on the right. So I'm going to go ahead and go with Board Member Schaaf and then Jezierski.
Thank you, Chair. So I have 2 questions. And first of all, thank you to staff for your presentation. Thank you for your hard work. I drove by the Health and Human Services building today, and it looked like the testing lines were moving efficiently and people were getting tested. And that's always a good sign to see those people get in and get out and get tested and get what they need. So kudos for you to continue that work. Looking at the rationale for the Back to Business program and the fact that our certified businesses can't operate at that green level. Can you explain why the state has taken this position on not allowing those certified businesses to operate at a green level?
You know what, Councilmember Schaaf, I can't. I just know it's been something that's been included in the public health order. They have always considered that level green to be protect our neighbors as a level, and you have to meet even additional metrics to be able to qualify and be in protect our neighbor status. My assumption is that's the reason for it, but I would need to confirm that with the state.
Well, I appreciate that, and I'm wondering, in that conversation and in clarifying that further, I would like to see if it's possible for Broomfield to ask for a variance or maybe variance is not the right word, but looking for an exception to that rule to say, hey, we are at blue. We are one of the few counties, and we did stand up this Back to Business program, and we've moved through this. And is it possible for us to get a variance on that so that we can allow those certified businesses to operate at green?
Yeah, I'll bring that forward, Councilmember Schaaf. And I do know they also are working on another iteration of the dial that will include capacity limits that they're discussing would be updated in March. So it may be revisited at that point and the capacity limits may change, but at the same time, I will bring that forward.
Great, I appreciate that. And then my other question has to do with vaccinations. So we had a total count of 17,835 doses, 78% of the 70 plus and 43% of the 65 and 69-year-olds. I'm curious that there are other age groups in Broomfield that are getting vaccinated according to those different phases. So teachers and things like that. How many total doses how many people have been vaccinated with at least one dose within Broomfield? And what does that number look like? Do you have that number? And can you share that number with us?
It's 1735.
So we've had over 5,471 Broomfield residents that have been immunized or received one dose of the vaccine. And I would have to go back further and break it down if you need it by age groups.
Okay, so let me clarify that. So you said 5,471 people have received one dose?
Yes.
So I guess I'm missing a number then, because in your presentation you had said that over 17,835 doses have been administered.
Yeah, I'm looking at our website, Councilmember Schaaf and Deb. Do you know the discrepancy there?
Yes, it's because the number you were citing was just first doses. It doesn't account for people that have received 2 doses. And then there's also the lag between when the doses were allocated and when they were actually uploaded in the system. So that's where, you know, the information that we have on our website is being updated daily. And so you have to add the first dose residents with the second dose residents to get that total number. And it's differing probably than what's in our presentation because the numbers change daily. So.
Okay, yeah, I'm still not following. So if you can, Mr. Valiant, if you can follow up, I'd appreciate getting that more clear picture of what those doses look like. Thank you. That's all I have.
Board Member Jezierski.
Thank you. Jason, Deb, thank you again for your presentation today and continued work. Jason, as you mentioned in your presentation and alluded to, but as you know, I guess, Adams 12 is contemplating going back to the 4-day-a-week full-time. Contrary to a lot of what you've heard, you know, my family and kids are a little concerned about that because you are going to be going from a much smaller class size to probably a minimum of 80% capacity, if not more, depending on how many families decide to go back for these full 4 days. So it's my understanding that the decision to do this was based on a really a much lower level concern for the 6-foot distancing. So can you comment on that or give me some more information on that? Because I mean, clearly when these kids are going to be going back to school, they're going to be in, you know, much more cramped classrooms, and I guess even more concerning, I guess, is the cafeterias where they're going to be not just sitting in probably really close quarters, but also, you know, non-masked while they're eating. So, what were your thoughts or reasoning on that?
Yeah, thanks, Councilmember Jezierski. First of all, one thing that we've seen from the data from the fall is intra-school transmission of COVID is extremely low. So at the point where we're at now, where you don't have large community transmission and we see less we know there's less intra-school transmission with all of the mitigation measures that are put in place. The fact that they're bringing students back feels comfortable to both Broomfield Public Health, but also Tri-County Public Health. As far as the social distancing, we're still recommending to achieve 6 feet social distancing whenever possible, but there are just some situations that is not feasible within a specific school or classroom setting. So that's where those exemptions came into place, that if you can't achieve 6 feet of social distancing, you might have additional protective measures that you could put in place as a school district. And ultimately, and my son is making this choice as well, it all comes down to a personal choice for you and your kids of whether or not they feel comfortable and safe going back to school. And my son, it's not an issue of feeling safe. He just has got into such a routine of online learning. He's worried about another change of going to yet another way of learning. So I'm giving you my personal experience.
And that's a great point, and definitely not a conversation for here. It's the change I think that my kids are personally just sort of upset with, because they've been doing 2 days a week and felt comfortable with that, and 2 days at home, and now, like you said, another change in learning. But that's for the school board. Yeah, but for purposes of this, you know, I'm sort of half and half on it. I get that the current measures have been successful, and I think that's mostly true. But it sounds like a lot of these measures will now be sort of set aside, particularly the 6 foot thing, because that's just knowing what legacy is like. It's just not going to happen there. You know, both in the classroom and even more so in the cafeteria again. I mean, it's, you know, they're going to have to force 2/3 of the kids to go outside and eat. And hopefully the weather's nice. But yeah, outside of that, I don't know how they're going to keep a cafeteria even remotely distance, you know, over the next few months. So yeah, I think my kids are going to go back, I believe, just because they would rather be in person than on the computer. But they're definitely disappointed that the current model changed, because the current model did allow some in person, but at a much lower capacity than you know, what is going to be contemplated here next month. So
yeah,
I'm not gonna, yeah, and I won't continue. I know it's not ultimately your decision here. It's a school board issue. So my other comment is just a small thing. Even the dial was brought up again. You know, if that's ever being considered to be revised, and it sounds like it is, I would really like to have a portion of that dial show what does it look like to get back to normal. What does that mean? The dial's never really said that, and that's always been a pet peeve of mine. So, you know, what does that look like as we, you know, get closer and closer to that, as we are getting more and more of the vaccinations and the numbers hopefully continue to go down? You know, where does it get to the point where, whether it's restaurants or 100% outdoor venues are able to, or indoor venues are able to operate, and we're able to rip our masks off?
Yeah, that's the key question for everybody with modeling data. But you know, what we're hearing from the governor's office and also from the School of Public Health modeling team is, if we could get to that point of herd immunity, and that's both people that have already come down with COVID and have some immunity, and those that receive the vaccine, getting to a point that we see community transmission at such a low level that it could be contained. And I've heard that could potentially be late summer to early fall. And what the governor has talked about is at some point we may not even need a statewide dial, that it would be dependent on, like we would treat any other infectious disease, local disease conditions and how we need to respond to it locally.
I think that's great. I just would like to be able to see what those, I know they try to use metrics for everything, and you know, what do the metrics look like to get to that point? Because for, you know, whether we're going from green to blue or blue to yellow or however that works, there are metrics to get to those different points. But there's never been the metric to get to that, you know, normal, you know, back to where we were 12 months ago. So, you know, what is that? You know, what does it mean for herd immunity? What's that percentage, or what's the level of transmission need to be to get to that point where we're, like you said, operating at a normal level and just treating it like the flu or any other infectious disease? So that's my comments. I want to know what are the goalposts, basically.
Sure, I'll follow up on that.
Thank you.
And well, regardless of what you said, Jason, was that we will have a dial 3.0 between now and when we're out of all this. So, and you anticipate that in the next weeks?
That's what I've heard from the state and the governor's offices. In March is when they're looking at revisiting the dial and specifically addressing capacity limits.
Okay, I guess that makes sense. This is the first time for everybody, right? So, okay, so That ends the comments and questions. So there be no further business before the Board of Health. The meeting is adjourned. There is no business before the Broomfield Housing Authority this evening. And let's go into council business. Our first item this evening is the public hearing and council consideration, a proposed ordinance number 2148, amending sections of the Broomfield Code regarding procurement of goods and services. I will declare the public hearing open. We will follow the city standard public hearing procedures. First, staff will present a summary of the proposal. Then we will have the applicant's presentation if applicable. Then we will ask for public comments and final comments from the applicant. And finally, questions from the city council. Council has a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Our first item for the public hearing, the Director of Finance, our Chief Financial Officer, Brenda Ritchie, will walk us through this second and final reading to amend sections of the Broomfield Charter chapter. Brenda.
Thank you, City Manager Hoffman, and good evening, Mayor, Mayor Pro Tem, and members of council, as well as distinguished staff. As Ms. Hoffman mentioned, Brenda Ritchie, Chief Financial Officer. And before you this evening is a proposed ordinance amending certain sections of the Broomfield Municipal Code regarding the procurement of goods and services, as mentioned. Staff is specifically requesting to amend the approval of spending authority limits for the city and county manager or their designee related to the individual or aggregate purchases agreements with a single vendor up to $200,000 during a calendar year. Currently, the City Council approves agreements in excess of $75,000, which was established roughly 7 years ago in 2014. After reviewing and comparing data from federal, state, and local entities on approval thresholds, and speaking with our external auditors, as well as analyzing the volume of agreements and the cost of inflation across the years, staff proposes that the City Council's approval limit increase to those purchases in excess of $200,000. Staff believes that by increasing the thresholds, it will create better alignment between the federal micro purchase levels, which would help mitigate the risk of non-compliance with federally funded purchases. As an example, a prior audit finding indicated that differences in Broomfield's procurement levels and the federal micro purchase levels allowed for certain federally funded purchases to be approved without meeting that federal criteria for solicitation, even though the purchases were in compliance with thresholds outlined in Broomfield's ordinance and guidance documents. Aligning Broomfield's thresholds with those of the federal micro purchase levels just ensure that any future potential risk is mitigated. Staff also believes that the proposed ordinance will help increase internal efficiency by reducing the amount of administrative time required to prepare formal solicitations and written quotes, as well as reduce the amount of contracts or agreements required to be presented to the council. Over the past 4 years, City Council has reviewed and approved a total of 215 agreements, averaging roughly 54 a year. By increasing the thresholds, this could result in an average of 28 agreements for council review, or a 47% decrease in council memos. While efficiencies are gained, staff will continue to maintain compliance with our internal controls related to purchasing as outlined in the procurement manual, the municipal code, and just general best practices related to procurement. Staff is also working on rolling out a transparency portal on the finance website that will provide detailed information on not only on just Broomfield's finances, but also allow the council as well as the public the opportunity to view transactions with vendors, including those that would be in excess of the current threshold of $75,000. Tonight, staff is requesting consideration for the approval of the proposed ordinance before the council, amending certain sections of the municipal code regarding the approval authority and procurement of goods and services. That concludes the staff update this evening, and staff is available to answer any questions regarding the proposal. Thank you.
Okay, we'll proceed with public comments. If there's anyone who'd like to be heard, please press *3. State your first and last name and neighborhood for the record. Once again, I'm not noting anybody that's that wants to speak about this. There are a few for item 11B. So we'll go to questions from city council members are next. Are there any questions? And I'll point out to council, we're still using the rules that we talked about with our attorney Nancy Rogers that ask the questions down. If you want to make comments, whether you're pro or favor, we'll do those afterwards. But this period is for questions for staff. At least we're going to try that. So are there any questions? We succeeded. There's no questions. There being no further questions or comments, the public hearing before the city council is closed. Next is council consideration of proposed ordinance number 2148. Will the clerk please read proposed ordinance number 2148 by title?
Ordinance number 2148, amending certain sections of chapter 3-20 of the Broomfield Municipal Code regarding the procurement of goods and services by the city and county of Broomfield. Second and final reading.
Is there a motion? Mayor Pro Tem.
Thank you, Mayor. I move that ordinance number 2148 be adopted on second and final reading and ordered published by title.
Councilmember Groom.
Second.
Is there any discussion? And I won't read the amendment language here. So will the clerk please call the roll?
Groom,
Yes.
Hinkle,
Yes.
Jezerski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Limstead,
Yes.
Schaff,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata.
Yes.
It passes unanimously, and I'll note for the record that the Councilmember Tessier now is on the line, so all 10 council members are attending. So we will then move on to item 11B, which is council consideration on first reading of proposed ordinance number 2149, regulating marijuana within Broomfield. Council has a copy of the agenda memorandum, which staff will summarize.
Hi, good evening, Mayor Pro Tem and Council. Nancy Rogers from the City Attorney's Office. I'm going to introduce Christine Franciscani, Courtney Seaman, and also on for this staff presentation is Brandon Rowe from Planning, and they'll walk you through this first reading.
Good evening. Next slide, please. On this slide, you can see where we've been and where we're going. Tonight is the first reading of ordinance number 2149 with the second reading scheduled for March 16th. The licensing process is slated to begin on May 3rd when the regulations go into effect and the moratorium on retail sales expires. The deadline for applications will be 60 days from the effective date of the ordinance, August 31st, 2021. Next slide, please. Staff has made changes to the regulations since the January 19th study session. Highlights include an amendment to allow medical marijuana sales, enhanced language for the merit process and marijuana licensing authority. Next slide, please. Changes further include phasing in stores, a health education sign to be displayed on site, language on fines, and language on walk-up, drive-through, and delivery. Next slide. The regulations also now include phasing in additional stores for a total of 5. The process begins with the first 2 licenses, and then as the regulations are set out, starting 24 months after those first 2 are issued, 1 additional license may be issued each year until we reach 5. The time frame for additional licenses can be shortened to a 12-month period following issuance of those first 2 licenses. Next slide. The regulations set out the process for license review and issuance. First, the clerk, as the licensing authority, receives the applications and after confirming that they're complete, publishes them for public comment. Public comment for these licenses will be handled similar to public comment received for other matters. Staff did not include the specific process in the ordinance so that the clerk's office, in concert with legal, can utilize the best practices for public comment being utilized in Broomfield throughout the life of the licensing process. As of right now, that includes Broomfield Voice, but that could change in the future, which is why that level of detail is not included in the ordinance itself. The next step is that the clerk sends the applications to the selection committee for evaluation, and the selection committee reviews the applications on a merit-based system that is very similar to Longmont's. Next, those that meet merit, and only those that meet merit, go through to the lottery. On the advice of consultants we have utilized, staff recommends this hybrid approach because it treats all applicants who meet the merit standards equally. A merit-only selection process creates potential for legal challenge if there are more applications meeting the merit criteria than there are licenses to be issued. The qualified but unselected applicants could contest the denial of an application, arguing that the decision was arbitrary based on vague criteria and/or improperly graded criteria used to pick between two arguably equal applications. This risk can be minimized by using a precise objective merit criteria process followed by a random selection procedure. The first and second businesses selected in the lottery are then the first and second in line for a license. Next slide, please. The regulations now require applications to include a sustainability plan that describes how the business will mitigate impacts from things such as energy and water consumption and waste generation. Next slide, please. And on to Courtney Tiemann.
Hi, good evening. We heard at the study session from multiple people and it made a lot of good sense to have some type of education as part of these marijuana businesses. And so what we included in the regulations, what staff included in the regulations was the requirement that there be an educational sign posted in the premises, and the sign would be furnished by the Broomfield Public Health and focus on the health impacts of marijuana. Next slide, please. In the regulations, there's a section that talks about the unlawful acts, which are prohibited. The unlawful acts section, so 542-260, would allow the city to prosecute violators in the municipal court, so in a criminal law context. If there was a conviction, if there was a plea, if there was a no contest, then the court would have the ability to sentence the person pursuant to the general penalties set forth in the Broomfield Municipal Code. And at this time, those are up to $2,650 or up to a year in jail. This prosecution could include individuals, employees of the store, individuals visiting the store, and it could include the businesses themselves through the criminal law process. In addition to the unlawful acts set forth that could be prosecuted in criminal law, then we also know that there's the licensing scheme that is set up in these regulations. And so under this chapter, a licensee, right, so the business, the owners, can be held accountable for violations of this chapter in front of the local licensing authority. And for those of you who sit on the local licensing authority, you know what that looks like for liquor license violations. And it would be very, very much the same here for marijuana license violations. If in fact it was proven that there had been a violation by the city prosecutor, then the local licensing authority would have a number of possibilities of ways to hold the licensee accountable. As noted in this slide, there could be a fine, the imposition of a fine, and there's a pretty big range here between $500 and $100,000, and that falls in line with the state fine, schedule for marijuana as well as liquor licensing. However, the local licensing authority is not held to just the possibility of a fine. They can also suspend a license for any given period of time. They can revoke a license. And then we've also written into the regulations that there can be other considerations that are required in connection with a license. And again, just speaking to those of you who have sat on the local licensing authority before, sometimes there are very creative ways to figure out how to solve a problem. And obviously, if there are violations of the licensing scheme, there would be a problem. And the way that the regulations are written now, that is left open. The last thing that I want to note here about the local licensing authority, and if there are violations of the code that are brought in front of the local licensing authority, is that we do have this really big variation, right, in possible fines. And so what you'll see is that the state right now, actually, in their regulations, they kind of have a matrix created that looks at violations in different levels, right? There are serious ones, there are moderate, and then there are minor. And what that matrix for the state level does is it gives the licensing authority these categories, right? And how much possible fines are going to look for each of those categories. It also lists out mitigating and aggravating factors. And so what we've put in the regulations here for Broomfield is that the local licensing authority would also create some type of a matrix to guide them as they are dealing with license violations. Next slide. So for walk-up and drive-through, and it's the same actually for delivery, which I'm going to talk about in a minute. But the way that the regulations are written, they don't require a separate permit for a walk-up and drive-through as part of a business or for delivery as part of the business. But the regulations are written to give Broomfield local control over walk-up and drive-through and delivery. And the way that they do that is that they require walk-up and drive-through. We'll talk about walk-up and drive-through first. They require that any kind of a walk-up and drive-through plan is included in the application. And by requiring that plan to be included in the application, we then have the ability to hold the business to that plan, because that also is written into the regulations, that businesses must comply with the plan that's set forth in their application. So for walk-up and drive-through, we have that local control piece built into the regulations. In addition, it's, on the physical premises of the licensee. We did include, and the Broomfield Police Department, as you can see in the memo, had some ideas about how to further regulate walk-up and drive-through, and those are included in the regulations. On this slide here, I've listed local requirements, and I just want to tell you which ones are specific to Broomfield and which ones are also on the state level. So using the electric ID scanner to verify age is on the local level. All vehicle occupants must be 21 and over. We heard that from a couple different people and included it, as well as the police department, and so included it in the regulations. What that actually looks like, in practice, I think is kind of open to the plan of the business. Because if you, of course, have a vehicle that pulls up and there are multiple people inside of it, how do you determine that they all are 21? I think there are different ways to do that, but it's written to the regulations that it's a requirement. And so that would have to be included in the plan of the business. The video surveillance bullet is a state regulation. Orders must be placed from a menu. That's a state regulation. Having and requiring the windows for walk-up and drive-through to be separate, it really seems intuitive that they would be. But I think the Broomfield Police Department really had some insight here to make sure that they were required in the regulations, because although it seems intuitive, it's now required. Next slide. So delivery, as I was mentioning, we also have that local control as I noted that any kind of a delivery, if an applicant wants to be able to do delivery, they number one have to have a state permit, and that's required by the state. But number two, their delivery, their plan has to be part of their application. And so that gives us local control, because the plan will be part of the application, and then we can again hold them to their plan. In addition to that, the way that the regulations are written, only Broomfield businesses may deliver in Broomfield. So the state says, look, we're allowing delivery, and you have to have a state permit to deliver, but you can only deliver in municipalities that allow you to. And so what Broomfield now is saying, you can deliver, but you can only deliver if you're a business that's here. And so again, we have local control because they will have a local license. They will have had to include it in their application, and we can hold them to that plan. The state regulations for delivery are detailed. And in the memo, we listed out, I think there's 12 different pieces of the regulations that are listed in the memo. There are other things that are included, such as limits on delivery to in a single day to a person, right? It's limited to 1 ounce for both medical and retail. There's a requirement that they take a responsible vendor class and have the responsible vendor certification. And there is a section of that that addresses aspects of delivery. And so what you can see is that the state regulations are fairly detailed for delivery. In addition to that, the Broomfield Police Department has made additional recommendations, and those are listed here. They're also set forth in the memo. Those aren't required at this time in the regulations. That's not because staff doesn't support them, but the state regulations for delivery are already pretty detailed, and so we just want council to know that these are the Broomfield Police Department recommendations, and of course they can be included by amendment if that is the direction council would like to go. There's a couple, next slide. Before we get to questions, actually, there's a couple other things that I just want you to know. In the prohibited acts, it was brought to a good question was brought up, and that was in the way that it's written in the regulations here, you can only sell a certain amount of marijuana per transaction. And of course, the goal is to only sell a certain amount of marijuana per day to an individual. That can be amended to make that more specific in the regulations for Broomfield. I do want council to know that that is also a state requirement. For medical marijuana in a store, you can only sell up to 2 ounces per day to an individual. There are some exceptions, but that's the general rule. For retail, it's 1 ounce per day to an individual. For delivery, for both medical and retail, it's 1 ounce. So those regulations are there for the state. And then another question had come up about making sure that our regulations made it clear that people who were working, employees of the stores, could not only not be using marijuana or substances or be under the influence. And yes, our regulations do prohibit that. And if that happened, we would be able to prosecute that in municipal court. The last thing that I want council to know is that there are representatives from the police department that we have partnered with on this work, as well as public health, that are both present and available this evening to answer questions. And with that, staff concludes their presentation.
Okay, we'll move to public comments. We do have some people on the public comments, and so let me go. I'll state you have 3 minutes. Each person is on the list right now. We have 4. You have 3 limits. State your full name and your neighborhood if you're a Broomfield resident. For the record, and we just lost James. Doug, do you know what happened? Because I suspect
I still showed James in the queue.
You do show him
James in the queue.
So do you need to screen him again, or can we go ahead and have him go first?
Actually, let's Yeah, James did drop off. Sorry, my screen just reloaded. Let's go with Jan.
Okay, we'll go with Jan. Jan, state your full name and your neighborhood for the record. You have 3 minutes.
Thank you, Mayor Quinn and council members. My name is Jan Billsborough, and I'm a Red Leaf homeowner. We all care about our community and its residents, neighbors, children, young adults, seniors, and the businesses we rely upon. We know that the council has decided to allow recreational and medical marijuana sales. There are several ways you can help protect young people, residents, and businesses. First, where can stores be located so marijuana isn't readily attractive to young people? The proposed setbacks are 2,500 feet from residences. Lafayette has a 500-foot setback and 1,000 feet from K-12 schools. Those need to be a minimum. Why is a portion of the shopping center next to Legacy High School a possible location? That distance could be increased. And why should our key identity corridors have pot shops? Other cities have limited specific street locations, and you could do that. The RAND study out of California found that young people aged 18 to 20 who live in neighborhoods with more stores and signage use marijuana more frequently than their peers and have a more positive view of the drug. The Colorado youth rate of marijuana use has stayed the same since legislation, but the potency of the products has increased dramatically, causing serious health implications, which are quoted in the CCOB website. When medical marijuana was legalized, the average potency of the plant was less than 5%, and there were no concentrates available. Now, concentrated marijuana averages a THC level of nearly 70%, with many approaching 95%. Now, I heard Christine explain that the ordinance doesn't include specifics regarding public comment, and what I've noticed in the current regulations is that they include less public notification and opportunity for comment than liquor licensing provisions. So I ask that as you consider other practices in other municipalities, that you would consider publishing the notice of marijuana applications in the newspaper.
Jan, your
and
time has
inform
expired.
those. It has. Oh my, I only have about 3 more sentences. Could I finish up?
No. Thank you.
All right. Well,
Okay.
I'm sorry to hear
I hate
that.
to be so boundary oriented, but I am. James, you're next. State your full name and in your neighborhood.
Thank you, Mayor and City Council. This is James Marsh-Holshin, live in Brandywine. This is one of those topics that I think is interesting because it brings out people from both sides of the issue who are truly sincere and good, well-meaning and want what's best for the community. I know that children get talked about a lot in this issue, and I'm a father. I have 5 children ranging from 19 months to 19 years old. And so this, I'm obviously something that's an issue to me. I don't want my kids smoking marijuana or, taking edibles or anything like that. But I am encouraged by these regulations and thankful that Broomfield will be bringing retail sales to Broomfield. I do respectfully feel like the negatives that people believe happen from this are largely overblown. I've looked at a recent study that said 55% of all domestic violence instances involve alcohol. But a University of Pennsylvania study said that correlated that marijuana legalization has actually caused a decrease of 40% in serious domestic violence instances where alcohol was already a factor. Furthermore, American Medical Association pediatric study saw that marijuana legalization actually has caused an 8% reduction in teen use. So I do think that's a little over, the fears are overblown. On to the economics of this, which I think is the important issue, is people are buying marijuana. People who live in Broomfield are buying it already, but we're losing out on the tax revenue. Edgewater recently, a few years ago, built their civic center largely with marijuana money. It was just in the Post yesterday that Aurora is building a $41 million rec center, 100% with marijuana tax revenue, and we are missing out on that information, that money stream, and I think that's a detriment to this community. If I have to make one comment on the actual regulations, I think they're actually too strict. I think, I understand the desire to go slow on the number of stores and cultivation, but I would actually like to see the marijuana regulations to be the same as liquor store regulations as far as zoning requirements and the numbers. I mean, I understand we're only starting with 2, and I get that. I understand the desire to go slow, but I think that we're losing out on tax revenue based on that, and I think that we should be a little bit more aggressive, but it's something that we can look at down the road. So I appreciate council doing this, and I look forward to see this regulations pass. Thank you.
Thank you, James. Tom, you're next. State your full name and neighborhood for the record, and you have 3 minutes.
Yes, Thomas Botter, and I live in Broomfield Heights. And thank you, council, for your time. I want to first talk about the fact that Broomfield already has a youth substance abuse problem. And Broomfield has applied for and been granted a federal grant, a 5-year grant to address this substance abuse problem. One has to wonder if opening more marijuana shops is going to be good for the substance abuse problem. I also have to wonder when those potential pot shops include a location such as the one immediately adjacent to the Girl Scout shelter and playground. We already have a problem in that area with homelessness. Now we're going to have potheads to join it, because it's been proven that when people go into the store and buy the pot, they often leave and smoke it relatively quickly after departing, especially tourists that have nowhere legally to go and smoke it. I also want to talk about the fact that I would like to object to the map that was published as potential locations for the pot shop. In the bottom right corner of that map, the city and county of Broomfield says they are not responsible for the accuracy of the map. How can that be a legal map to determine where pot shops are going to go? I would also like to talk about the Broomfield Enterprise. We read it all the time. There has been no coverage on this subject in the Enterprise. The people of Broomfield are not aware of what's going on. Finally, we don't need the money. Everybody says we need the money. I recently sent City Council an email where I said, isn't $6,500 enough for every man, woman, child, and infant residing in Broomfield? I received a counter saying the actual number is about $2,500. Well, no, it really isn't. The actual number is somewhere between $5,500 and $6,000 for every man, woman, child, and toddler. So we have a city that struggles to be affordable, but we are spending $15,000 per household. We don't need the money from marijuana. It seems to me, I've heard at the very beginning that this was the pot shops were going to be put in industrial areas. Putting one in Garden Center is not an industrial area.
Hey, Tom, your time has expired.
Putting them next to Jackson isn't industrial either.
Thank you, Tom. Shannon, you're next. State your name. It's noted you're not a resident, but you are representing a firm, I guess, and you have 3 minutes.
Yes, good evening. My name is Shannon Fender. I'm the Director of Public Affairs for Native Roots. We are a local Colorado cannabis company. We operate in 11 other jurisdictions in Colorado, and we're very excited about the prospect of being able to apply for a license in Broomfield. And I just want to thank council. I know this has been a very long and deliberate process over the last 9 months, and thank you for your thoughtfulness. We did submit some written comments, so I'll be brief. We do believe that Broomfield should remove the lottery requirement. I think that, you know, we are looking at this merit process, and it's very robust. It's based on Longmont, which did not have any issues with legal challenges. You know, the process that Broomfield has recommended is reinventing the wheel in terms of having this two-phase license lottery process here. And so we would hope that that would be removed, and that those that, you know, rise to the top in terms of their commitment to Broomfield would be able to be based on those merits. Second, the application timeline and process. We do know that, you know, you all would like to be thoughtful in the rollout. We don't believe that 5 stores over 5 years, we believe that that's pretty exceptionally and arbitrarily slow in terms of the rollout for a population of your size. And we do believe that with the merit-based application and the high quality of operators that you will be getting in the application process, we believe that it'll be a pretty smooth rollout for you, and that the proposed timeline really just adds unnecessary complications to the licensing process, and then additional work for staff and applicants, and potentially future opportunity for legal challenges. We would like to say that, you know, we would support the parity with alcohol setbacks, although we think the map is fairly good right now as well. But if you would like to go a little bit less restrictive, you know, our hope in that when you open your community up to retail marijuana sales, that you would want us to be successful, and that you would want our locations to be in places that are frequented already by patients and adult customers, and that are in places that are convenient for people to go. And so we would really ask that there be no further restrictions on the map. Regarding delivery, we would request that no additional restrictions be placed. The state does do a very good job regarding public health and safety on delivery. It's very, very highly regulated. It's not the type of kind of Grubhub or Uber Eats model. And so we do believe that the state rules are designed to protect public safety. And also, we
Hey,
would
Shannon,
recommend that
Shannon, your time is up.
Okay, thank you.
Thank you. Cindy, you're next. State your full name, who you represent, and you have 3 minutes.
Thank you very much for the time. My name is Cindy Sovine, and I am here representing High Q, which is a chain of dispensaries that operates along the Western Slope, as well as a MIP and a cultivation. Everything is done organically. We are very interested in your process. I've been following along and going through the history of what you're doing, and want to thank you for the open process that you have here. We also submitted written comments, so I'll be brief on mine, but it really is also specific to the merit-based system versus the lottery. We work in a number of other jurisdictions that have also contemplated this question, and we've found time and time again that local governments that go down the road of having a lottery often end up regretting it, because it takes them out of the driver's seat and being able to select the applicants that are the right fit for them. Many of the concerns that you hear from your constituents around marijuana, many of those concerns really can be addressed and mitigated through having a hands-on process where you are the one in the driver's seat selecting your applicants. The current process that you have now, which is more of a hybrid model, I think to the point that was just made, really is duplicitous in terms of the efforts for staff time and the time it takes you to go through them. But it also, again, puts it to this random chance in selecting an operator. And there's no way for you to really assess the best in class or have them otherwise be able to rise to the surface in that kind of environment. And so you've done a lot of work to really take a thoughtful and measured approach into how to do this and do this right and respectfully of your constituents and the residents of Broomfield. And by then taking all of that work and then rolling the dice at the end of it, you are in a sense disempowering yourselves to be able to ensure that you have best in class operators that are not only going to produce revenue for you, but be a part of your city, be a part of the solutions that you need in it, and all of the things that come along with that. So I'd really like to just take this moment to talk about going more into a merit-based system and getting rid of the lottery and selecting your applicants by that process, which is much more like an RFP where you look at checking boxes. And this is where you reduce your legal liability because you would have an actual objective process that was weighed and measured in selecting them, as opposed to something that is more random, but then begs the question what we see in other jurisdictions.
Cindy, your time is up.
Thank you very much.
Yeah. I hear that we have somebody else in the queue right now, so I'll give a second. I will make a comment while he's being screened to all four. I guess you can all recognize that it didn't matter whether you were advocating for or against. I set the time at 3 minutes because council asks me to. I was fairly abrupt with Jan and Tom, and I apologize. What I do want everybody to know that's listening or watching is council members do read the memos that we get. I think it's safe to say that all 11 of us read those memos. So, so if you write us memos, we're good. But when we get to tonight, we need to get to council debating the issues. We do greatly appreciate the public input. But council it has got to limit the time, and we limit it to 3 minutes. And I need to draw that line. So, did he sign off, Guyleen?
Mayor, maybe you should remind them to press star 3. I don't know.
Yeah, press star 3 if you want to be in the queue. So,
okay, it's coming through now. Star 3 to make a comment.
And we bend over backwards to make sure everybody's heard, just for 3 minutes, or less if there's a lot. And then council, what I was going to do after these, there's 2 in the queue, and I was going to go ahead and have us take a break because there's no logical place to take a break after that. We're going to be discussing as Nancy has shown us, there are, like 11 amendments being proposed, and I want to talk to council after we get back on the, after we get back on how we can address those amendments. And so anyway, we do have somebody on the line. It says Sarah, but I mean, so Sarah, state your full name and neighborhood, and you have 3 minutes.
Good evening, Mayor and Mayor Pro Tem and Council. This is Sarah Taylor from Brimfield Heights, first filing. I just wanted to point out that if you were to stuff the limited number of recreational marijuana shops into industrial areas, the standards for access are different in industrial areas, and sometimes you have to, if you have a wheelchair, you have to park far away and go on a really long ramp. And a lot of people with disabilities use marijuana, and they don't use the medical process because it's sometimes burdensome. If you stick with a regular retail environment, then the access for people with mobility impairments is a lot more equitable. Also, the bus access is better in regular retail areas. Industrial area placement of marijuana shops would be very discriminatory for people with disabilities. I would also like to just add my opinion that marijuana should be regulated exactly like alcohol within the limits of whatever the state has imposed upon you. That's all. Thank you.
Thank you, Sarah. Karen, state your full name for the record. and your neighborhood, and you have 3 minutes.
My name's Karen Glover. I'm still new to Colorado and Broomfield, so I'm not really sure what neighborhood I'm in. But I
Fair
just
enough.
wanted to discuss briefly regarding the fact that dispensaries should not be on a main road. I just feel that if anything is going to apply in the town in regards of cannabis sales, it should also be applying to other sales such as alcohol and cigarettes. So anything that doesn't fall within the realm of falling into both of those type of businesses really kind of feels discriminatory against this particular business. And I don't want to see a town of mine that I live in now to be discriminatory towards anyone for any reason whatsoever.
Thank you, Karen. I'll go ahead and there's no one else in the queue, so I'll go ahead and cut off public comment. And once again, when we come back, what I wanted to do is find some way we can group together and talk about the amendments. Go ahead. I think the way we're talking about doing it, go ahead and have the motion made and seconded, and then Nancy's going to show all the amendments that are being proposed, and try to find some type of order. What I had proposed earlier today at our meeting, I think the Mayor Pro Tem agreed, was that those who are advocating amendments that maybe speak first, talk about their amendments, and then the rest of the council members would have a chance to speak. We would have a chance to then speak, and then we would bring each amendment at a time.
Point of order, Mayor.
Yes. Yes.
Yeah, thank you, Mayor. So I just wanted to clarify. So will we be able to ask questions first before we start talking about those amendments?
You want to ask questions first before we talk about the amendments?
I would prefer that, Mayor.
Okay, and I hear everybody saying that. So we'll go ahead and we'll go through questions first when I get back, and then we'll go to the amendments and try to group them together. I'm here to serve council and a good conversation. So, okay, so here's what we're going to do. We're going to take a break. We'll be back at, let's go ahead and say 7:50. And then we'll have a 5-minute round of questions for everybody on council. And then we'll go through the amendment process. Agreed? Okay, so 7:50.
The Access Live event is in music hold.
Okay, Nancy, you're right. Okay, Doug, you know, I have it at 7:49, so when it hits 7:50, bring us on.
Roger that, Mayor.
Jennifer, are we having trouble with the web?
We're checking now.
Mary, do you need me to wait or?
Well, I mean, Jennifer, I mean, what does that checking mean? I mean, somebody could just try to see if it's on, right?
Jake is pulling it up right now, Mayor.
Yeah, Doug, wait a second, because I'll have to give different if the web's down.
Roger that.
Oh, there it goes. Yeah, we're not having an issue with it, Mayor.
Okay, so we're okay. Doug, let's go.
Roger that. 5, 4, 3, 2, 1.
Music hold ended.
Thank you. We were just checking out, we'd heard a report that there was a problem with the web page, and it's my understanding there was not. And so we're going to go ahead and proceed. Ms. Rogers notified me that we had planned on having questions next, and so she reminded me that's what we plan to do. So that's what we're going to do. We're going to have questions from City Council. Are there any questions? I suspect there are. So, Councilmember Schaaf.
Thank you, Mayor. So I do have some questions. So I sent an email into staff earlier today discussing the setback map that we have. Do those setbacks include setbacks from homes and schools, from neighboring municipalities and counties for their uses? And for instance, just to be more specific, for instance, do the sites in the shopping center of 136 and Zuni meet the setbacks from the homes across the street in Westminster?
Councilmember Schaaf, we have Brandon Rowe from Planning Department on the line today. Brandon?
Good evening, Councilmember. So the map that had been shared in the previous study sessions did not include that setback. However, as the regulations are drafted, we would measure that and ensure that any potential location moving forward would meet those setbacks from adjacent communities. Collecting that data took a little longer than we had hoped, so we didn't have that ready for you.
Okay, well, I appreciate that. And that would be something that I'd want to see before our second reading. So I'm glad to see that, that's already in the regulations and that's taken care of. So the setbacks for other municipalities, other counties would apply as well. So I won't need to make an amendment on that.
Is there any other questions?
Yes, I do have more questions. I thought someone was going to speak. There was a note about an outside consultant being used, Mr. Rowland. Has he completed the review of this first reading regulations, and will he be completing a review before the second reading with any amendments made during the public hearing tonight?
Dan Rowland did complete a review of all of the regulations that we've proposed this evening, and certainly can do a review of the next set of regulations after amendments this evening.
Perfect. Thank you for that. Next question. In the required documents an applicant must provide, it talks about providing documentation about security, but this really kind of lacks specificity about how secure those locations are. It just kind of says, you know, behind a locked door or in a locked cabinet or something like that. Do we need to be more specific as to how secure those plans are, or what? How does that specificity work within those regulations?
Councilman Schaaf, we did get some comments today from Dan Rowland that were helpful to answer your question. We've previously had some questions about whether all products could be required to be moved into a vault during closed hours. And one of the things that Mr. Rowland identified is that the state requires already 2 levels of security to get even into the facility, that like literally 2 different locks on 2 different doors. So it is my understanding that the state regulates security for these facilities in great detail, and that what we need to know as Broomfield is what the plans are so that we can be sure that we're comfortable with what the security plans are, and so that we know the possibilities of what the plan for the facilities are if something goes wrong.
Great, thank you for that. So just to go back to my last question, so it sounds like that Dan Rowland, Mr. Rowland, did provide some comments that have not been incorporated into these regulations at this point.
That particular comment that I referenced was in relation to a potential amendment. And he just happened to generally comment on the security that the state requires. So I just happened to have that handy.
Oh, okay. All right. Thank you for that clarification. I appreciate that. So looking at there's a requirement for the applicants to have a relationship with a financial institution. And I thought that marijuana businesses really couldn't have a bank relationship. So can you explain that that relationship more and what the expectation is for that?
I can answer that one, and if anyone else wants to fill in, that would be great as well. It's been a while, but I did do research a while back because one of the council members had a question about whether debit or credit cards could be used. There are banks currently that do work with marijuana institutions and have figured out a way to do that. I believe the state of Colorado has sponsored that effort. And I think the federal government is also looking at a way to do it, but there are now actually banks that they can partner with.
Great, thank you for that clarification. So looking at the method for revoking a permit, I'm a little unclear what that process would look like. Is there some type of, 1 strike you're out, 2 strikes, 3 strikes kind of thing? What does that look like for revoking a permit on a applicant or on a licensee holder?
Sure, it's a similar process to what you can see in liquor licensing now. So the Broomfield Police Department would be doing compliance checks on the licensees. And so that means a number of different things, going to the store, perhaps sending minors in to attempt to purchase marijuana, etc. In addition, there could be a complaint that comes in. And if we learn that there's a possible violation, then the city attorney's office through the prosecutor can issue a show cause or request a show cause order from the local licensing authority to bring the licensee in front of the authority and address the violation. Then if in fact it was shown that there was a violation, the local licensing authority would at that time have the opportunity to basically sentence, right, the license holder. And that could include revoking a permit. It could include other things. And it's really going to just depend on what happened, right? What is the violation? Because am I answering your question, Councilmember Schaaf? Okay, because violations, of course, could range anywhere from somebody not recording, one piece of information in their records. And when we look, we find that. But it could also be a pattern of sale to underage people. And so those two are going to be treated very differently. And the local licensing authority is who has the authority to make the determination about what that sentence looks like.
Okay, great. I'll withhold my comments on that and stick to my questions at this point. So we had a public comment today that talked about the First Bank Center. And I was curious, and I'm not sure if the police chief is on tonight, but maybe city manager can answer for this. Are there concerns from the police department with potentially having nearby sales of marijuana to the First Bank Center during those concert nights?
Councilmember Schaaf, Gary Krager at the police department. And I also have Kent Witchlatch on, who is worked very closely on these regulations. Again, the method of the delivery and the location of the sale is based on the regulations. Certainly, we would just follow the regulations on whether or not there was a store located within that area. And Commander Witchlatch, if you have anything to add.
Thanks, Chief. I have nothing additional on that one.
All right, thank you, Chief. So there was a public comment tonight that public notice standards are different from the liquor licensing standards. And I just wanted to clarify that because I'm not seeing that, but I wanted to clarify that.
Thanks, Councilmember Schaaf. So just find my notes on that. So public comment for this process is something that will be similar to public comment received for other matters. In this case, we wouldn't necessarily notify a specific area like we would in the land use case because we want public comment from the entire city and county. We do want to utilize the best practices, which right now could include posting the property because we will have with these applications a property that is identified as a potential store, notice on our website, notice on the Broomfield Voice. We are, one thing that is different from liquor is that what we've done is proposed publication of all applications, and that is not what's done with liquor. It's just the applications that are successful, I believe.
So does that mean do you mean to say that the public notification is going to be greater than what it is for liquor licensing?
It's different from what it is for liquor licensing. There are some similarities and some differences.
Okay, all right. I'll talk to you offline on what those differences and similarities are to get a better understanding of that. The next question is in the regulations, and I'm just looking at my time, and it looks like I still have a couple minutes. It says in the regulations that medical marijuana facilities must be co-located with retail. And I was curious why that is being recommended by staff.
The recommendation has been made to require co-location. That's the most conservative approach. When you require any medical marijuana facility to be paired with a retail marijuana facility, that automatically requires that everyone accessing that facility for any purpose, retail or medical, is 21 and up. Broomfield can regulate the age of patrons, but typically under state law, medical marijuana is 18 and up. A standalone medical marijuana facility would allow for patrons to be 18 and up.
Thank you for that answer. I appreciate it. And then my last question is, can we restrict the types of products sold at these at any medical or recreational marijuana establishment, or the packaging look of those products?
It depends on, Councilmember Schaaf, what you're referring to when we talk about restricting the products. For example, in all likelihood, limiting potency is preempted by the state. So that type of restriction would not be something that we would be likely to able to do. The state is also very specific with labeling. I don't know if any of my coworkers might better remember than I do, but I think that labeling might be preempted as well. And I see Courtney nodding. So you have any?
I know I did that research with tobacco, and it was
please feel free. And it looks like Nancy's nodding as well. So we. I'm sorry, I'm getting a notification of my connections on stage.
Yeah.
Yeah, Christine, we'll fix your connection. Courtney, why don't you chime in?
I guess I don't know where Christine left off. I will tell you, I did the preemption research when we were looking at tobacco, and certainly labeling was preempted as it pertained to tobacco. Christine is correct. The labeling requirements for marijuana are very specific. So I would say with reasonable certainty, it would be preempted for that as well.
Okay, and I bring that question up because there were a couple of concerns regarding the use of really the attractiveness for youth in those edible products that are marketed in a fun and whimsical way. So just wanted to see if that is an option for something that could be restricted.
Councilmember Schaaf, if I can jump in real quick. Our consultant, Dan, had also provided the feedback that as a local government, it's challenging to get into the regulation of the product when we're dealing with, especially being centrally located around other communities that have products too, that it operationally is very challenging and would require a lot of additional expertise in the city of Broomfield to regulate in that area. So even on the areas that wouldn't be preempted by the state, it would be an operational burden for Broomfield to take on the regulation on top of the state of products in that manner.
I appreciate your answer. That's all the questions I have. Thank you, Mayor.
Councilmember Groom.
Thank you.
Perfect. I was already off mute. Sure, I know I need to go through fairly quickly, so if staff could limit a question for Ms. Ritchie in regards to the email I sent earlier on tracking and reporting the sales revenue. If we are limited to 2 or fewer stores, are we still able to report sales revenue, or would there be any confidentiality issues?
Sure. Thank you, Councilmember Groom, for the opportunity to answer. So a couple of questions on how the sales tax will be tracked and reported. So the Finance Department's Revenue Division plans on following the same protocols it uses with other business entities in Broomfield. Basically, we'll establish and assign a specific industry code that is recognized federally, and along with a dedicated account. So that's the tracking purposes of the revenue generated. However, both Colorado Revised Statute and the Broomfield Municipal Code prohibit Broomfield from disclosing any entity's specific sales tax and use tax information unless the business itself has entered into a voluntary disclosure or there's a judicial order. So the way the revenue would be reported is the same as other Broomfield entities by basically rolling up the aggregate into, from the revenue generated on a monthly basis, so that any sales tax generated for marijuana sales would be reported, for the prior month that it was collected. So regardless of the number of businesses, the sales tax attributable to a specific entity would not be disclosed. And that's because of the confidentiality requirements around sales tax. And staff would take every precaution to ensure that we maintained compliance with those state and local regulations.
So just to make it clear, sorry to interrupt, just to make it clear, can we report marijuana sales tax independent from other revenue?
We can't. We'd have to look at what the industry code is to do so, but we would be able to report that in total to say that
in total.
Unless,
I'm not asking
correct.
for individual stores. I'm just saying in total marijuana revenue tax. Can we report?
That is correct.
And then my leading kind of, maybe I didn't ask my question, is some there is a concern that if there's 2 or fewer stores, we won't be able to report or disclose the total marijuana revenue, because you would be able to drill down and have clarity to those 2 stores. So I want to make sure if we're limiting it to 2 stores, we will still be able to report marijuana revenue, even if we have 2 stores.
That's correct. You'd run into the issue if you had 1 store. So with 2 stores, you wouldn't be able to assign and determine which store was generating which revenue.
Okay, so we've got 2 stores, we can report marijuana revenue.
Correct. At a minimum, it would be.
Thank you, thank you. I just needed that clarity. We definitely need full reporting. And then I'll go through some of my other ones. I am not in favor of delivery. However, if the majority is wanting it, I would definitely want the recommended amendment as stated by our police division. No lottery. I do not support the lottery. I think our merit would hold strong. I want to make sure that we're selecting the businesses that we want here and the branding that we want here. I think it's very important that we select the branding. I want to, the signage and the branding is very important to me. The revenue estimate, I do want to say that, Broomfield, and I know I always bring it up, we have a debt, a $2 million debt, and any new policies, any new, anything we roll out, we need to make sure that we're estimating that expense. And I know on this specific one, we are thinking that the revenue is going to cover the expense, but I want to see that. So I do want to see the an estimated budget covering the expense with an additive of how much that policing will be, as well as the health plan, to make sure that we are positive on that. And I will be looking for that as bridging between now and the second reading. And then on the 5-42-120F, I do think that this needs to be very similar to the liquor license, where they do go out and notify the neighbors in a certain area of establishment, just like the liquor license needs to. I would like to see that changed. And then
Kim, this is the question time.
Huh?
This is the question time.
Yeah, and then I do want staff to comment. My question is I had a question on, can we limit the THC levels? And staff sent an email back, and if they could just state that publicly, where there is a state preemption to limiting THC levels, and also the local enforcement. If you could just explain that in public.
Councilmember Broom, yes, thank you for your question. We do want to make you aware of the issues regarding limitation of THC potency. It is in all likelihood preempted. The state is looking at the issue. We did check with our consultant on whether any other jurisdictions at this time are attempting to regulate it, and there are not any other jurisdictions at this time doing it. And additionally, and I think this might have been mentioned previously, if Broomfield were to try to regulate it, it just would be costly and require a level of expertise to regulate it.
Okay, thank you. And Mayor, I'm so sorry, I forgot we were doing the question thing. It was an old habit. So I deliberated and I didn't ask all my questions. So thank you very much. Appreciate it.
Councilmember Lindstedt.
Thank you, Mayor. I only have 3 quick questions here. One of them is a follow-up to Councilmember Schaaf's question about security. I was just wondering if staff could elaborate on how the merit-based system includes security measures by applicants.
Councilmember Winstead, I can try to answer that. I'm just going to try to get to the section in the regulations that addresses that. So first of all, the application does require a number of things, including a floor plan and a security plan, but a floor plan showing the security. And then let's see, along with a copy of the alarm monitoring contract and some other things. But let me get down to the so right now, the code references the quality and detail of the proposed security plan. That is something that we'd be relying on folks with some expertise. We've talked with the police department about being able to put at least one person on that to be able to properly evaluate it.
Thank you. And then my last two questions. One was about the time that it will take staff to review these licenses each year, or these applications each year. How much time are we looking at to have this process reopened to add more licenses over that 4 or 5 year period? Is that a big staff lift to review these licenses just to select one applicant each year? And I don't know who to direct that question to.
Councilmember, I can answer that question. You know, the staff burden is going to be dependent on how many applicants we receive, because every applicant has to be reviewed. So whether it's 1 license, 2 license, or 5 license, each one has to be reviewed. They do take a lot of time, and we've been in contact with the clerk's office to figure out how we're going to staff, especially this first push for the 2 licenses, and even including maybe continuing on with our consultant to help in that review. We do expect it'll take a lot of time, and we'll need to involve other members of the city, like Christine just mentioned, including the police department, and we need to include finance in different parts. So I can't give you a good estimate on time per applicant, but we are expecting this to be a pretty big staff pull.
So if we did, say, 5 licenses, or on this first go, or we did 2 licenses now and then 3 night licenses in 1 year instead of 1, it would overall be reducing the amount of time staff is spending reviewing these licenses to do them in bigger clumps instead of each year for the prescribed period.
Right, because we expect that no matter the number of licenses, Broomfield's going to receive 18 applicants this first go round, and next year, if there's 1 license open, 18 applicants again. So yeah, I do think that grouping them together could be helpful.
I appreciate that answer. Then my last question was just from one of the comments on the public record about technical language. We had a question from someone about registered managers, key holders, and managers. I think that's trade terminology that's in the regulations. Are we sure all of our language is is in alignment with the state law and the terms used in state code?
Christine, I'll let you talk about the review on the terminology.
Sure. I did see, thank you, Councilmember Winstead. I did see that comment, and let me just find in the regulations where it references key holder. There is a potential for an amendment to that specific language. I might want to look more deeply, but that is in section 5-42-250. Let's see. And then it is towards the bottom. It's in P, the last subsection. So it references the old owner or a key holder responding to something. And I think that the industry person who commented probably has some concern over that and would rather it be required specifically the manager do that. And I do understand that concern, and that is something that we would be totally fine with amending.
And we could do that in second reading after staff has had more time to review the specific terminology.
Sure.
Okay, great. Great. Those are all my questions, Mayor. I appreciate the time.
Councilmember Jazerski.
Thank you. Just one quick question. This is a follow-up on a question that Councilmember Chef had. His first question regarding the specifically the shopping center on 136, and it was noted that the map that was presented to us didn't include setbacks for neighboring communities like Westminster. So do you guys know offhand just if the setbacks from Westminster are included, would anything be available in that shopping center on 136? It's the King Super Shopping Center. Right now, there's like 2 parcels that were shown on the map, I believe.
Councilmember, I don't have that information in front of me, but we can definitely get that for you and follow up either for second reading or prior to second reading for you.
Yeah, I would appreciate that because that's will make a difference on some of my decisions. Thank you. That's all.
Thank you. Councilmember Tessier.
Can you hear me?
We can.
Okay, thank you. I have a few questions. One is about like the quality. I mean, and I know that marijuana industry has is tested. Can you explain a little bit about how they do quality control? So I know what if I'm getting something today, it's going to be the same thing I get the 5th time I go or the 25th time I go. Does that make sense?
Councilman Tessier, Gary Kreger, the police chief, that's really heavily regulated at the manufacturing level by the state of Colorado. Everything from RFID tags on each plant, tracking of the plant, the cultivation of the plant, all of that is done under very controlled conditions that are regulated by the MED department of the state.
And do you know if they do like randomized testing or like quality check controls?
I believe they do random checks for pesticides and things like that that are used in it. And again, that's all highly controlled by the state. They are subject to inspections by the state and tracking of their products by the state.
Awesome. So it's pretty, you know what you're getting. And I think that having regulated material is way better than, especially when we know what, if anybody is taking something and they OD, we know that we can help them, right? That's kind of where I was going with that question. Okay, thank you very much. With regard to delivery, I'm curious to wonder why we would want to limit delivery specifically in Broomfield County. I don't think we do any limiting of any other delivery business. And I'm just curious on why we would want, like if our product is, if we're doing all of this and we have higher quality product, why wouldn't someone from Westminster who also has delivery, you know, I'm just kind of curious as to what would be the pro of having delivery only at a particular county versus delivery to other counties. And do you see that the retail shops or medical shops have a preference to which way they go? I shouldn't say preference, maybe a pattern.
Right. So, and I'm sorry, I have my video off because the sound was breaking up, and I'm hoping this works better. So I apologize for that. Let me try and answer your question. And if I don't answer it, let me know. The first piece that I want you to know is that we aren't limiting Broomfield businesses' ability to deliver into other municipalities. So a Broomfield business can still deliver to Westminster if Westminster permits it, right? They can still deliver to Boulder or Arvada or Denver if the municipalities permit it. So,
okay, I must have heard it wrong.
The second piece, however, is why would we only allow Broomfield businesses to deliver?
Oops.
Hello?
We lost you, Courtney.
I can finish up for Courtney unless she's back. That first point was definitely true. If Westy restricts, then we can't deliver, but we're not restricting delivery outside Broomfield. But we are restricting delivery in Broomfield to those operators that are Broomfield businesses. And I think it was on the idea that we can create a relationship with these licensees, and we were the ones who reviewed their applications, and we know what they're doing within our jurisdiction. So the idea is only Broomfield businesses can deliver in Broomfield. We're not going to allow Westminster businesses or Boulder businesses to deliver in Broomfield.
I see what you're saying. Okay, thank you very much. I appreciate that. Okay, and then, okay, so I'm curious about the merit system and how it looks at organizations or businesses that give back to the community and are responsible, active members of the community, not passive, so I'm curious if you had any information on that.
I do, Councilmember Tessier. Hold on for a second. Let me pull up my notes on that point.
Okay, and while you're doing that, maybe I'll ask Chief Prager that my last question is that I'm a researcher, and all the research that I show is very conflicting. Could you discuss maybe in your experience or your insights a little bit about crime and retail marijuana and medical marijuana, and what you've experienced with crime, increase, decrease, but maybe it's both in different ways. So I'd be curious to hear your thoughts.
Sure, I did quite a bit of research on increased crime rates, and I kind of found the same conflicting information. But I stuck to FBI and DOJ and some of those. I think there was initially an increase in crime. You have an all cash business as it rolled out in the early 2010 and in that era. That really has not held true. I think it's really based on much better regulations that we've learned as a state and as the industry, better practices, and those kinds of things. So what you see in some of our recommendations are really just that practical safety issue, both for the citizens and for the businesses, because you have a large cash basis, just like you would with the bank or any other large cash business, just putting in those security protocols to help prevent that from happening.
Awesome. Thank you very much. And hopefully, Attorney Rogers, you.
Yeah, I do. So you had asked about community involvement and how will we know if these businesses are giving back to the community? There's a requirement for a community outreach plan. It's in 542-100 sub A. And it requires the applicant to talk about their history of community and neighborhood involvement with other businesses, written policies and procedures to address community concerns, a point of contact that we can utilize in Broomfield, and with comprehensive contact information for the entire business when we get public questions and concerns, and then measures and procedures for mitigating impacts to neighborhoods, either foreseen or even unforeseen. That community outreach plan is one of the merit criteria that's utilized in the merit part of the hybrid process to determine if an applicant meets our requirements. There's some other community benefit requirements or criteria that's utilized in evaluating the application. We included information about we included requirements that applicants must tell us how they're going to provide a living wage and employee benefits, and how they're going to comply with local, state, and federal non-discrimination employment laws. We had a requirement that we asked for additional information from the applicant that demonstrates their ability to operate in a safe and reasonable manner. These are in 542, 150B, 14, and 15.
Thank you very much. I appreciate all of the responses, and I also appreciate the questions from my fellow council members. Thank you, Mayor. That's all I have.
Councilmember Anderson.
Thank you. I have a couple of questions. We received an email this afternoon from Ms. Britton-Zetti that there was an error on the marijuana eligible locations map for the zoning for the Safeway Shopping Center. and strip malls at 144th and Lowell, which were errantly categorized as residential in the database. And just for clarification, this is in Ward 4, which is kind of why I'm focusing in on this area. It's in my area. Would the Broadlands Golf Course adjacent to the residential lots also be considered part of the, is that part of the residential, zoned residentially for that PUD? Or is the 250-foot setback just from the actual homes in that Broadlands neighborhood to that mall? I'm just trying to clarify if the majority of this mall is eligible or not eligible.
Councilmember Anderson, I can answer that for you. So the golf course and parks would be identified as, in this case, because it's owned by Broomfield, it would be identified as an ineligible location, but the setback would not apply to the golf course. The 250-foot setback from residential would be applied from the parcels and the lots that the homes are on, but not the golf course itself. So in that shopping plaza, there's roughly 4 or 5 parcels. You have the King Supers, which is the easternmost parcel. That's within 250 feet of the residential on the other side of the road. So it would not be eligible. The other parcels could potentially be eligible.
Safeway, right?
Yep. Safeway, I'm sorry.
Okay. Sorry, go ahead.
And I was just going to say that the other parcels to the west of that could potentially be eligible with the 250-foot setback as currently proposed. We would determine specific eligibility as the zoning verifications came through for particular applicants.
Okay, and this is in the so that golf course is not residentially zoned. No. Okay, so that would be eligible. So that does change something here quite substantial, because I know it's not that's a parcel that would be there will be concerns over that one. So I'm glad that was caught earlier on. Okay, thank you. And I've heard some information, some questions as to why does zoning, like why does setbacks matter and why does location matter? I'm just wondering if someone in public health could address just really quickly and briefly, again, I know we've gone through this before, but high level concerns regarding marijuana, such as youth access, addiction, and more. Specifically, there's a statement on, this is right on our Broomfield marijuana page, location matters. Areas with higher density of retailers typically have higher underage use rates. And this goes hand in hand with the RAND research study out of California that was noted earlier. And I'm just, this is very important for why we would want setbacks, and just love to hear a little bit of input from public health.
Councilmember Anderson, it's Jason Balling, and it's similar to the research we find in other areas around why location matters. It has to do with ease of access to the product, but also some of the potential promotion of the product as well. And Allison Long, who's done most of the in-depth research for me, is also on. And Allison, is there anything you would like to add?
Can you hear me?
Yes.
Okay. No, I don't think there's, thanks, Jason, and thank you for the question. I think the research shows that, in fact, areas with higher density of retailers typically do have higher underage use rates. And so localities that restrict the number of retailers in the community in proximity to schools can see benefits.
Okay, thank you for clarifying that. And there's that concern too for the developing brain at page 25 and other pieces that we have covered in the past. So I appreciate that information on the ease of access. And one last question. This one is for our city manager, Jennifer Hoffman. I'm just wondering if you can share anything for, mostly this is for our constituents regarding the baseline property. There is a large section of baseline that shows that it is eligible parcels, but the policy just it looks like there's a lot of available area right next to Anthem Highlands, but that is not currently the case. I wonder if you just comment on that briefly.
Certainly. Thank you, Councilmember Anderson. Baseline's philosophy for their current development and future development is not to, they do not support retail sales of marijuana in their development. We do not foresee that changing, not only for the foreseeable future, but for the future period. It's a philosophical and ideological stance that they've taken, and it's been long held in all of their developments.
Great, thank you so much. And that is all my questions. Thank you.
Councilmember Lim.
Yes, this is to public health again. So the health educational sign in 5-42-220, it says that it should be displayed and it will be furnished by Broomfield Public Health to educate consumers. Throughout the memo, there are notes that public health has concerns about preventing youth access and supports local control measures in the regulations. So do you have some preliminary idea of what you would require on that health sign?
Councilmember Lim, this is Allison Long with Broomfield Public Health. Thank you for the question. There are, well, first of all, I should mention that the state regulations do require already signage related to pregnancy. So use of marijuana during pregnancy. There are warning signs that are required by the state, but locally we could require additional information be posted. And I think what we would recommend is that there's approved public health statements that are provided by CDPHE's Retail Marijuana Advisory Committee. And so there's a number of statements that are, evidence-based that we could look to. For example, it takes up to 4 hours after consuming an edible marijuana product to reach maximum blood levels. So there's things along, the lines of consumption and concerns, and also things related to driving under the influence. If that helps.
Okay, thank you. Okay, so this is for other staff with the regulation that were involved in writing the regulations. So staff had told us that they had done quite a bit of research, and we saw it in tables and things, of best practices from other jurisdictions. There's a note on page 6 of the memo under the delivery section that marijuana delivery is relatively new in the retail marijuana market in Colorado. So did you have other jurisdictions to look at with best practices on delivery? And if so, what ones did you look at? And did they have additional regulations to the state?
Hi, this is Courtney.
Oh, thank you, Courtney. Go ahead. We're working to find a resource that we created. Go ahead, Courtney.
Okay, great. So my colleague, actually, Christine, took a look at a number of different jurisdictions that include places like Superior, Longmont, Denver, and Boulder. And what you'll find right now is, for example, in Boulder, there's a pending draft ordinance. And so there's a pending draft ordinance for Boulder. In Denver, there's a draft bill that's also pending. Those are two examples that I can give you where they're working on regulations for delivery. And yes, you can look at the ordinance, the draft ordinance and the draft bill. Those are things that aren't passed yet. They do have some pieces to that I can share with you. For example, in Denver, they address the time frame that delivery can happen. They actually allow for it between 8 a.m. and 12 in the morning, which doesn't change or make it any more regimented than the state does. They require an electronic scanner to be used to scan the ID of the person, which we've also included. Let me look. I think we included that for the walk-up and drive-through. They require things like all persons in the delivery vehicle must have proper ID. Delivery staff may not accept cash or cash gratuities. So there's some additional things. A lot of what you see is required by the state as well. But I guess what I'll note is that because this is so new, it's difficult to see what of these things is, what of these requirements is actually makes a difference. The state is very regulated here, and so that's why we really just are requiring the state permit, the business plan, and then, as you can see, the police department has some additional ideas. Does that answer your question, Council Member Lim?
Yes, thank you. Yes, it did. Thanks. The other question I think is directed towards legal also. This is my last question. So it goes back to the number of initial licenses issued, following up on Attorney Rogers' comment. So and this would, I think, precede Ms. Rogers. We've gone through an evolution, at least what I recall, and somebody correct me if I'm wrong, where in December at our study session, we were vaguely talking about 5 initial sites. And then in mid-January, the documents that we saw in council came back with 2 sites initially in the first year. So, and now Ms. Rogers was commenting on possibly it would be easier to do all 5 in the first year. But my understanding was it was staff's preference to have 2 in the first year. So I'm a little thrown off by what I think I recall with the evolution of initial licenses in the conversation, and that I thought staff wanted to, and now with Ms. Rogers' comments. Can anybody explain that better?
Yes, I'll follow up on that, Councilmember Lim. For Councilmember Limstad's questions, we were talking about application reviews, and I think the staff burden on application reviews is arguably the same whether we're giving out 2 licenses or 5 licenses, because staff needs to go through every application that we receive in a very detailed way. So that's where I was talking about grouping. It is staff's recommendation after we give licenses for the health department, for the police department, for those inspectors who will be checking on operations, to limit it to something that is more manageable. So I think that's where the numbering came in. But it was taking arguably a more conservative approach on the number of licenses that would actually be operating in the city that got us to the number of 2. But as you saw in earlier communications, there is an amendment that's probably going to be discussed this evening, increasing those amounts.
Okay, thank you for that explanation. Those are all my questions.
Mayor Pro Tem.
Thank you, Mayor. I wanted to kind of follow up on Councilmember Lim's questions about the health notice. And I guess I could ask our public health staff, do we require these at liquor stores?
My understanding is no, the health effects are not required at liquor stores.
What about gun stores?
No.
And places where cigarettes and tobacco products are sold, do they have to post health flyers?
Obviously, there's warning labels and so forth on the actual products.
Right, but not displayed where those products are sold.
Correct.
All right. Thank you, Mr. Volling. That's all I have.
Councilmember Hinkle.
Thank you, Mayor. I just have 2 questions. One is
just talking about setbacks, and what I was hearing from the health department is that, it seems like there's a high concern around schools, and so that's why the setbacks are set at the state, and that they let the local authorities kind of, handle the rest. And I'm curious as to if there's a standardized definition of high density then, if that's some sort of concern, is there a standardized definition of that, or we're just calling places high density? I just want to see if there's a definite definition of that.
Allison, do you want to address that?
Sorry, I don't have an answer for what a definition of the higher density would be right now.
Okay. And then for delivery, I'm curious, let's see, probably Chief Krager. I'm just curious, I think I support your guys' additions to it. I'm just curious if the drivers, I don't know what the state regulations are on delivery. Maybe someone else can jump in here with this, but I just am concerned about signage on the cars. And if they had the signage of, hey, we're from such and such dispensary, if they could be a target. So I'm wondering if we could limit with delivery services, if we can prevent signage on the cars.
I believe the state already regulates that.
I can answer that. Thanks, Chief Krieger. It is actually prohibited that the vehicles be marked. They're not allowed to be marked at all.
Okay, I couldn't remember, and there's a lot of state rules for sure. So thank you. That's all the questions I have right now.
Okay, I'm going to go to Ms. Rogers and Ms. Ritchie, who wanted to clarify the comment on the tax revenues and what reporting we can do.
Go ahead, Brenda. Brenda, you're back. Great, thank you.
Thank you, Ms. Rogers. Thank you, Mr. Mayor. This is in response to Councilmember Groom, and I wanted to clarify, it was my oversight, I shouldn't write in pencil, but basically the state follows the 3 or more vendors requirement that Broomfield also follows in regards to confidentiality and the sales tax return information, making sure that it's really 3 or more vendors and any one vendor that does not constitute more than 80% of the total sales tax number. So therefore, if the amount is limited to 2 retailers, we would not be able to disclose because we release sales tax information only if there are 3 or more vendors and any one vendor does not constitute more than 80% of that total sales tax number. So wanted to make that clarification and apologize for the oversight. Thank you.
Mayor, may I comment?
Yes, you may. On the answer, yes.
So I probably will make an amendment on that, just to let everybody know. Thank you.
Okay. That concludes the questions and comments from council. I'm pausing for a second. So let's go to consideration of proposed ordinance number 2149. Will the clerk please read ordinance number 2149 by title?
Ordinance number 2149, regulating marijuana establishments within the city and county of Broomfield, first reading.
Is there a motion? Here, I'm not in the right place. Mayor Pro Tem.
Thank you, Mayor. I move that ordinance number 2149 be adopted on first reading and ordered published in full, and that a public hearing on the ordinance be scheduled for 6 p.m. March 16, 2021, to be held virtually as allowed by City Council procedures and rules of order, that the second and final reading on the ordinance be scheduled for March 16, 2021, following the public hearing.
Councilmember Lindstedt.
Second.
Okay. Councilmember Anderson, I was going to move forward with the discussion.
Don't we need to do the amendments first?
We do. That's what we're going to do next.
Okay, good. Thank you.
But
can I jump in at this?
So
So I know this is an odd situation for council, and I appreciate everybody's patience as we deal with doing amendments rather than substitute motions. We're going to share a screen with you in a little bit so you can see all the potential amendments that might come forward this evening. And what we had talked about with the mayor and the mayor pro tem and the city manager was to have a comprehensive discussion about the marijuana ordinance as presented by staff, plus some of the amendments or all the amendments if you want to comment on them. And then at the point where a council member feels ready, you can move to amend ... whatever your particular language would be. So that's sort of the goal here today. I think some important takeaways. We've got to make sure we have a motion and an amendment, a motion and a second on each amendment and a vote on that amendment. And then after all the amendments are done, we're going to need to call the question on the larger ordinance as amended. And staff's ready. We've got multiple people ready here to take notes and make sure we get those amendments as correct as possible.
So and let me stress, and once again, as Ms. Rogers said, you know, we've never had anything quite like this. So the point would be, you know, for the hands that are up, if you want to make your amendments now, I'm asking for people to maybe wait until we have a discussion, you know, so we discuss the amendments plus the deal, and then we'll go amendment by amendment at that time. Because it just seems to me a lot of the amendments are overlapping, you know, there's a lot of deals. So what I was recommending today, and council can certainly change that, what Ms. Rogers said, let's not make the specific amendments. We will go through each amendment and let them be made. Let's have a discussion of the amendments and the proposed ordinance together. That's what I'm proposing, and then go amendment by amendment. Okay. If I've got Councilmember Schaaf nodding his head, then I think I'm okay. Okay. So Nancy, so you're going to put the slide up?
Yes, if you just give us just a second.
Yeah.
It might make it challenging for you to see who's raising their hand, but hopefully this will help. That's pretty big. And we'll just leave this up during the discussion.
Okay, and I can see who's you know, and you know, this for the public as well. You know, well, I'll let each council member go ahead. And so once again, the point would be asking council to wait to make the formal amendment, but to go ahead and discuss the amendment that you're proposing along with your discussion of the ordinance to begin with. So I'll start out with Councilmember Hinkle.
Thank you, Mayor. Just so that I'm clear, am I just talking about the amendment that I want to bring forward, or am I talking about all the location amendments together?
You can talk about them all together at this point in time, and then we'll propose it. But I mean, the point is to have a comprehensive discussion about it now.
Okay. All right. Let me try to figure out how to get out of this exit full screen so I can read my notes, if you don't mind. Okay. So the amendment that I wanted to bring forward was the one to create a space where, you know, liquor is the same, treated the same as marijuana. So I just want to thank everyone for their thoughtful input. We've gone 8 years with prohibition in Broomfield, while our neighbors and other states have even made regulations so that it's accessible for residents. I want to thank you to my colleagues who have made trips to dispensaries, as we have all done our homework on this issue. The dispensaries we visited are more highly regulated than even liquor stores at the state level, so it's interesting to experience to even have to show my ID to even get in the door into the store. So my whole point today is that I think we just need to remove shame in the marijuana industry and those who need marijuana, and it is my hope that we can regulate it like we do alcohol. This was a huge theme in all the calls that we received and many emails. As a parent of a teen and a tween whom I educate on drugs, a former teacher, I'm an Adams 12 five-star school leadership academy graduate, and I also took the year-long Elevate team process to improve our school district. I have the utmost concern for youth usage, and I think education is key, and I would assume that everyone else is like this on council as well. So it goes without saying that Every council member wants to prevent abuse of any kind of drugs or alcohol, particularly in our youth. That being said, I also have youth who need this life-saving medication, even as young as 5 years old, and our combat veterans to help sleep. Many veterans choose marijuana over alcohol because it's not addicting and the effects are better. Also keep in mind that our state mandates that we regulate and tax marijuana like we do alcohol. That was the whole intent behind the state law. And my residents don't want to be shamed in areas that are not visible to the public because they are not invisible. Many of them are open about their medical needs, but even though they don't have to be. Many of you have seen the data comparing the two industries, so it's obvious that there's no medicinal value in alcohol, but in marijuana there is. There is more crime around liquor store areas and can lead to violence and addiction. While marijuana has its own set of issues, it is considerably less than alcohol, and I think we do need to follow the state mandates to regulate it like we do alcohol. That was the intent behind Amendment 64. People are already using marijuana in Broomfield. The only difference is that they get to purchase it with dignity in Broomfield. And I have families who don't want to feel like they're put into the dark corners of Broomfield. They deserve to shop with dignity, and they have teenagers in their home where they educate on marijuana just like they do liquor. As far as residential setbacks in other areas like Lafayette that we might be talking about, I was texting back and forth with their mayor, Jamie Harkins, and she said that I had a point that, hey, we should have setbacks the same as alcohol. She didn't know how or why they landed on 500 feet, but we also know Denver has no residential setback and our own laws have no setbacks on liquor. Jamie even said that we should probably look at updating our regulations since it's been a while. They updated them in 2014. So I did some research on setbacks in marijuana and alcohol, and there's no data touting that marijuana sales need to be further away from residences than alcohol. So the comparison is just, it's not there. Marijuana stores are known for their compliance too. In 2019, liquor stores had 29 times more infractions than marijuana in the state of Colorado, and liquor stores had 117, whereas marijuana only had 4 infractions. So to be true to Amendment 64 and the intent that was passed by our own residents and the state and the feedback that we're hearing, I want to keep the school setbacks because those are important as stated by our health department, so I agree with them, and they're mandated by the state, but I want to remove the residential setbacks so that it matches our liquor setbacks. Thank you.
Thank you. Councilmember Jazierski.
Thank you. I'm going to take a little bit of an opposite tack, as you probably assumed from Councilmember Hinkle there. I certainly appreciate where she's coming from and all the council members that will support her position. But I am concerned that there are a lot of members in the community yet that aren't quite there. And I don't think comparing alcohol and marijuana is quite fair. Those are really comparing apples and oranges at this point. Those are two different drugs, I guess we could call it, or two different substances. And one has been around with us for many years, since Prohibition, most recently, and the other one is fairly new to the state of Colorado still, and certainly going to be new to Broomfield. So given that, I would much prefer a slow roll and a slow introduction. I'm certainly not against having marijuana in Broomfield, but I would like to be a little more conscious as to how we introduce it into community and to where we introduce it into community. Originally, my concern was really keeping it off of our main busy, or we restricted it, I guess, to off of our main busy thoroughfares in the community. I mean, after some discussions, I am going to pull back on that a little bit, but I still remain concerned about, what I would call the busy family-orientated shopping plazas, where you're going to see a lot of children, a lot of families visiting, a lot of teenagers that will be visiting areas that we see teenagers visiting on a regular basis. Those are areas where I really would like to limit or restrict the exposure. I think our residential setbacks, as been proposed, do address some of these areas, but there are gaps. And the amendment that I'm going to propose today addresses some of those gaps. And specifically, the areas that I'm concerned with would be along 120th. It would be the King Soopers Plaza, where I know is incredibly busy at all times of day with families and kids and children. The Walmart Plaza, where I could tell you that my teenage kids have been walking to and now driving to, both to Walmart, the Goodwill, the burger places there, Five Guys, for the last 2 or 3 years. So that's another area of high concern to me. There's also schools across the street from from that area over in Bradburn. I'd also be concerned about the Safeway Plaza on 120th, currently vacant, but we have plans there to develop, hopefully sooner than later, a downtown civic center, very family orientated. So that stretch basically from Lowell to Main Street to me is very important, and I'd like to limit and restrict the ability of a marijuana facility to locate on that area at this time. Other areas that I'm concerned about, we heard from some staff members, I guess, over at Emerald that the corner on Midway and 287, where we had a caller today as well, near the Girl Scout shelter. There are some potential spots there that I'd like to limit access to. As we discussed, there's a possibility on 136 at the King Super Shopping Center right there. It's not clear at this point, so I think my amendment tonight would include that area as well, just out of a precaution. And that is right across the street, as we've heard from Legacy High School. And I could tell you that probably hundreds of kids every day visit that plaza, during lunchtime. So I think it would be unwise to have a facilities in that one. And then finally, as was discussed tonight, the Safeway Plaza on Dillon Road. It's close to our parks and a golf course, and also close to residential neighborhoods and very family oriented as well. So I'm trying to be open-minded about all of this, and I think this will still leave plenty of areas, both within our industrial, but also in other commercial areas, within the community of Broomfield for the 2 or so marijuana establishments that we emit. But it does provide a more careful and a considerate approach, and keeps it a little bit out of sight from our youth, and I think that's a big concern. I'm done. Thank you.
Councilmember Schaaf.
Thank you, Mayor. I just want to thank the members of the public for engaging in this issue. We've gotten some emails, we've gotten some public comment tonight. And there's one resident who lives in Ward 3 that I owe a phone call to, so I will be making that phone call in case you're listening tonight. My goals for these marijuana regulations, and I think that I've heard, from a lot of residents, that the top issue is restricting youth access. For me, I have a zero tolerance for stores selling to youth or knowingly selling to someone who is selling to youth. I just don't have tolerance for that, and I would like to see that reflected in these regulations and future enforcement of this. That for me is something that's kind of a no-go, and I think that we've heard that from our community, that having youth access is just not okay. I would like to discourage the abuse of marijuana and other substances. And I think that this is a great reason why we have the revenue primarily going to Health and Human Services, and it isn't paying for things like open space or recreation trails or recreation centers or trails or other municipalities are doing. But this is going to really discourage the abuse of marijuana as well as other substances that are being abused. And I think that this is another thing that the community is asking for. I would like to set up our marijuana businesses to succeed in a safe and responsible manner. That's the same goal that I would have for all of our restaurants, our gyms, our bars, and so on. That they operate and that they operate in a safe and responsible manner, but they are successful because their success means that Broomfield succeeds as well. So I want to make sure that they're visible and that they have the abilities to succeed. And to that point, I want to ensure that our standards apply to all of the city and county, that we don't base some standards off of arbitrary rationale to limiting or expanding access into certain areas of Broomfield based on council members' personal feelings, that these should be standards that apply to all, if we have a residential setback, that residential setback is there, or a school setback, that school setback is there. We don't just remove parcels based upon our feelings or our notions that we think that, for some reason that should be expanded or limited. I appreciated the Chief Krager's points regarding the First Bank Center. That was a concern from a resident. I still do have a concern, and I would be interested in further conversations with the chief as well as with other council members about about marijuana shops proximity to the First Bank Center, or finding other ways to ensure that marijuana that is being sold near the First Bank Center doesn't end up contributing to the problems that are going on with marijuana use inside the First Bank Center. That just seems like we're adding to a problem that already is there. And then I think the last piece is that I really do look forward to hearing more about the conversations that staff is having with Boulder and Aurora, as I think that those are important conversations, and I look forward to the additional information that comes before our second reading. So I appreciate staff's time on this, and I look forward to the rest of council's comments.
Councilmember Law Evans.
Thank you, Mr. Mayor. I appreciate the time, and I certainly appreciate the discussion so far. I will say that based on the discussion so far, it still seems like we are a long ways away from any kind of consensus. And if we're still in information gathering mode, as Councilmember Schaaf just noted, that he looks forward to hearing what staff finds out on this, that, or the other thing. This feels very premature to me still, but my guess is that sentiment is not shared by a majority of council. But I will say, and I've said this all along, in my opinion, and this is just my opinion, this has not been a very upfront process with regards to communication with our citizens. Council put a question on the ballot some time ago about taxing marijuana without really talking to citizens, telling citizens that council actually has the power to extend the moratorium, make the ban permanent, or to put the question of whether or not to have retail marijuana sales or medical marijuana sales. I guess those are two questions, but to put those questions to the voters. I'm one of those old fuddy-duddy type people. I do not want any kind of marijuana sales allowed in Broomfield. I just don't. I have firsthand knowledge of the devastation that it can wreak, and to say that it's not a problem and that fears are overblown and whatnot is frankly insulting to those whose lives have been devastated by this drug. It's irrelevant whether or not marijuana is better or worse or the same as alcohol. We're not really talking tonight about changing the alcohol regulations. So I think that's a straw man. At any rate, on the current trajectory, it appears that council will let the moratorium expire here in a relatively short period of time. So if we are going to allow sales in Broomfield, then I want the strongest regulations possible, especially, as Councilmember Schaaf noted, with regards to youth. And as we're going to have a discussion later on this evening, funding, making sure we have adequate funding for mental and behavioral health. And I will support all amendments offered along those lines tonight or at second reading. But, and I have no doubt that this will irk someone, council, I am going to make, this is my formal request for a Section 18 discussion to be added specifically to council's agenda on March 16th, 2021, as follows: that council discuss extending the moratorium and putting this question of retail sales to the voters. We have had a huge number of emails and phone calls and personal conversations over the past week or thereabouts from people who felt they didn't know this was going on. They didn't know that it was coming up. They now that they understand that council has not asked, but rather simply went straight to the question of taxing. I had one resident tell me he felt hoodwinked by this. And I feel again that it's important to put this on the ballot. We've discussed it before, but I'd like to keep on discussing it until we actually do it, is what is my preference. So I will follow up with an email. I will support any and all amendments tonight that strengthen the regulations, but I certainly will push for I'm going to request a Section 18 on March 16th to discuss yet again, trying to put this on the ballot. Those are my comments. Thank you, Mr. Mayor.
Councilmember Anderson.
Thank you. So are we just, we're covering the ones under location, so this would be an appropriate time to discuss the setback from Children's Hospital, correct?
Yes.
Okay, and I will also comment on what I have heard. So, so regarding the reason I brought forward the setback for hospitals, I was specifically looking at Children's Hospital on Highway 7, which currently there are no residential setbacks that apply here. So the parcels adjacent on both sides of Highway 7 would actually be available for a marijuana retailer to open shop. And I just think that would be a very wrong impression as parents are bringing their children into Children's Hospital to have marijuana shops adjacent to the hospital. Not that they would necessarily go there. I don't think it's even the desirable place because in talking with those who are actually in the industry, they want to be co-located with someplace that people frequent, and that doesn't make sense. But so regardless, I would like to bring forward a proposal to create a setback near Children's Hospital, and if it has to be for both hospitals, it would also include the UC Health Broomfield Hospital down in Arista Place. And so I don't know if we can, that's a staff question, can we specifically target just the Children's Hospital and not like full general hospitals? And the second piece is Lafayette has a 1,000 foot setback and Aurora has a 500 foot setback from hospitals, and other communities, I don't know exactly what their setbacks were, but they were in that realm. So to ask for a 500 foot or 1,000 foot setback would not be unreasonable, but I do want to hear comments from others. And if that is too much and we're concerned and it has to apply to both, for the UC Health Broomfield Hospital, a 250 foot setback would have zero impact on the available parcels. So at a very minimum, I will be proposing a 250 foot setback from Children's Hospital, but I would actually prefer to do 500 or 1,000 feet. I just want to make sure it's something that we can actually pass and approve as an amendment. And I do want to know, so that is all for that. And then regarding, I do support Councilmember Jezierski's proposal to specifically look at certain plazas. On our, others have stated this tonight, preventing youth access is critical. That has been at the forefront of the discussions with my constituents. I have many constituents that are in favor of actually retail sale of marijuana, but not at all costs. They do care about the youth access. And from our own Broomfield Health Impacts of Marijuana fact sheet, it notes about half of high school students feel it would be sort of easy or very easy to get marijuana. So this isn't just about schools. The more accessible marijuana is, and I'm going to beg to differ with Councilmember Henkel, the more accessible it is, the more places it's put. When it's right in the mall where the students frequent, where their slightly older friends could go in, or and there's more places beyond that, I guess, bowling alleys or movie theaters or wherever, it's like the more accessible it is, the more likely the youth are going to access it. So I support keeping it away from the highly traveled areas. Thank you.
Councilmember Lindstedt.
Thank you, Mayor. I just wanted to start by thanking staff and the residents that have called in during this lengthy process we've been involved in. I would support these regulations as proposed today without any amendments. I think, overall they're in very good shape. They're very thoughtful, and they do a good job of protecting, public health and allowing Broomfield to finally benefit from the sales of marijuana instead of our neighboring communities that are eating up our tax dollars, so that we can finally use these resources to address issues of substance abuse and other mental health issues. So I think this is a really good thing for Broomfield, and it's been a long time coming. And I just want to thank everybody for going through all these study sessions and spending all this time creating this very long and very thoughtful set of regulations. I think we're kind of in the home stretch of amendments and things, but overall this process has been very comprehensive, very thorough, and in my view very transparent. And we've finally had a discussion about marijuana that we've never had in Broomfield. We've never been allowed to have in Broomfield. And we can finally support what the voters approved in 2012 in Broomfield and what the voters overwhelmingly approved this last election. So you know, just this has been really a rewarding process, and I'm grateful for it. I guess where I am on some of these other amendments in terms of location, you know, I personally don't see much of a difference between, you know, liquor stores and dispensaries. I know my residents have told me pretty overwhelmingly that they support recreational sales and are tired of driving so far away. So, you know, I will support that amendment. And in terms of the concerns about Children's Hospital and Councilmember Schaaf mentioned the First Bank Center, you know, I'd like to remind both Councilmember Anderson and Councilmember Schaaf that there are residents that live in these areas. There are residents who will be most impacted by this zoning who voted overwhelmingly in favor of our question last November on the ballot. It in those two particular parcels, I went and pulled up there were two particular areas. I pulled up the precinct map and actually looked at the breakdown, and it was over almost 50% in both of those wards, above some of the other wards. It was overwhelming. I mean, there were some of the most supportive precincts in the city and county of Broomfield. So please don't silence the residents who are most impacted, who live in these areas, who are saying, we want dispensaries. You know, I've fielded calls from that particular area down south. You know, one of the top concerns I got was, why do we have to drive 5 miles to get to a dispensary? So I don't, you know, these are areas where you have many less children. You have a lot more, you know, younger single people, a lot more apartments. It's a lot more dense. I question the need to add additional setbacks near the First Bank Center or near the hospital, because those residents live there and they clearly don't share those concerns. So please listen to those residents, and I would ask that my colleagues oppose those amendments to restrict businesses in those areas. In terms of licenses, you know, I think this is still pretty onerous. You know, I think doing 5 licenses is a very conservative approach. I looked up, I actually don't know the official number of licenses of Lafayette, but I saw there are 4 dispensaries in Lafayette, and you know, Lafayette's a lot smaller than Broomfield. We have 70,000 people here. We're 33 square miles, and we stretch all the way north and all the way south. You know, the geographic area of Broomfield is diverse and long, and you know, we can support 5 licenses, and I think that's a very conservative approach. So it would be my preference to move up a greater number of licenses, preferably 5, or at least doing them in 2 batches instead of doing them in 5 batches, where staff has to review them every year. And it just seems very onerous, very slow, and ripe for challenge. So I would much prefer that we do this in 1 batch or two batches, and get this done with, because it's been 8 years since legalization passed, and it's time. It's time to move forward for the good of our community. So I appreciate everybody for their hard work. I look forward to the discussion, and it's been a really good and rewarding process. Thank you, Mayor.
Thank you, Councilmember Lim.
Yes. On the location amendments, I had proposed an amendment that would restrict no more than 1 licensed premise on any given street within the city. So my reasoning for that is that we would actually, from a perspective of economic vitality and business opportunities, we would not want to concentrate all of these businesses on 1 street. That it would be better for the city if these were spread out and not all located on 1 street. There are a lot of parcels open, in particular on on Colorado 7. We've talked about, you know, how can we take advantage of those commercial parcels to support density for rapid transit. That's Colorado 7 is defined as our gateway image concern. So that's where the thought was that was behind that there should be no more than one licensed premise located on any given street. That's my amendment for location. I appreciate Councilmember Jezierski's focus in his particular restrictions on minimizing youth access. I heard Broomfield Public Health say that they have read studies that cite that usage is limited somewhat by lack of, greater access. So that concern of Councilmember Jezierski seems legitimate. And I'm also very interested, as Councilmember Schaaf was asking for a map of 136 across or near Legacy High School, and if the residences in Westminster were taken into consideration for the 250-foot residential setback, if that would prohibit 2 locations in that King Super strip from being eligible parcels then. Because I do think we should take into consideration our neighboring jurisdictions with the residential setbacks just as much as we should take into consideration the Broomfield residences. So I think those are my comments on locations. Thank you.
Thank you, Mayor Pro Tem.
Thank you, Mayor. I do support the amendment that the setbacks mirror liquor stores. And I can't support the amendment to restrict on major arterials because to me, this really limits the revenue that we can generate. You want these located on transit corridors where there's easy, accessible locations. And as we heard from one caller, accessible to those with disabilities. So I think that's really important to remember. I think I agree with the one marijuana store on one street to spread it out. And I'm thinking about the hospital setback. That's all I got on location.
Okay, Councilmember Tessier.
You, before I can really commit to limiting location, I definitely want a definition from public health about what high density means, and then location to schools. I need that information. In my research, 2 to 9% of the population in America has some sort of dependence on marijuana. And if we look at 2 to 9% of our population, I'm thinking that we have the tools at our hands, we have the communication, we have the outreach, we have a lot of potential to make sure those who don't should not be using it. And I think that is our youth. And I would agree that everyone on council is doing what they can to protect our youth and underage usage. And I think that having more programs that are preventative and having more coping mechanisms so we don't have to escape or rely on substance use to deal with hardships or stress, right? So I would like to get that definition. And this was from the National Institute of Health. So it was in 2017 and 2019 where they're talking about 2 to 9% of the population. I also think that instead of maybe Councilmember Lim's one street, maybe it's a certain mileage, like maybe it's, 6 miles, because Sheridan, Lowell, 120th, they run through multiple counties even. So I wonder if there would be like, instead of one street, maybe it's 6 miles or something like that across Broomfield, rather than that. The other thing I want to bring up is that dispensaries do not necessarily have to have the neon pot signs and to be really attractive to our youth. We can do them really classy. They don't have to have those neon signs. They can look like a clinic and you know, they don't have to really, I think they can be done differently, so we can make sure that maybe people with families who are walking by aren't even aware that it's a dispensary. So I think it can be done. I've seen it done. I worry about the setbacks to hospitals, because some of the people using marijuana are medically, like, they need it for medical reasons. So I'm torn on that one. I totally understand why you would want it, and nothing is simple that comes before us. We have to think and think of all these things, and we want the best for our residents, and we really do. And you know, wow, this is a challenge, and I really appreciate the work that the staff has done. I appreciate the work that our council has done. This isn't easy, and I'm hoping that maybe we can look at, rather than, and I get the clustering, like I don't necessarily want to see clusters, but I don't want to limit it to streets. So I will stop there with my location. So, and I'm leaning more toward having it looking at setbacks similar to the liquor license, but I want to hear from others. Thank you.
Councilmember Groom.
Yeah, I think I'm a little confused here with the locations and the setbacks. I think majority of council is wanting and supporting marijuana sales, but for some reason we're wanting to put it in the dark corners of Broomfield. And I think if we do something that is in the regular retail sites of Broomfield, that's classy, and like Councilmember Tessier just said, that is not screaming medical marijuana or marijuana, a green marijuana sign, I think it will be very appropriate for pretty much any retail location. I want to make sure it's not pushed into the dark corners. I do think that setbacks, some level of setbacks from schools and keeping kids away from it is obviously required, but I'm not quite sure if we're getting too far down into the details of major specific streets, etc. I do support no more than one marijuana store on a given street, so there's not clustered and it might be spread out. But I am not quite sure we're ready to mirror the liquor store setbacks. I think getting the setbacks as they're written right now implemented, and then seeing how that rolls out with a handful of stores, and then reassessing it in a few years will be the best. And I do not want to remove the residential setbacks as they stand right now. Thank you.
Okay, Councilmember Hinkle on the second round.
Thank you. I just wanted to kind of weigh in on the other ones. Just with the no more than one marijuana store, like I just sort of, I'm following and tracking with Councilmember Tessier that I feel like we just need to kind of measure it. I'm okay with like 1,000 feet from one marijuana store to the other so that they're not totally concentrated. But if you go down 120th, I'm not sure it's very fair to these stores to have, the setback. So, or the whole road. So if we already have the setbacks between the stores, that should be legitimate enough. If we have 1,000-foot setbacks from Children's Hospital, again, Every time I think about where marijuana shops are, kids are not going in there. Like I said, we had 4 infractions, 4, and there's 29 times that in liquor stores. So if we're saying like we're putting, you know, like basically like candy out for these kids, that's not the case. They're not coming in there and they're not buying marijuana. And I'm really kind of sensitive about this because the Serratos, I go into the hospital with them with their child, and I watch them give their son marijuana in the hospital. The workers there can't do it, but the family has to do it. And let's say they run out and they need to go outside of the hospital to get life-saving medication. So I want you guys to really view this marijuana, this is life-saving medication, and it's for people in need. And I don't, you know, harp on liquor stores because of alcoholics. You know, I'm not out here harping on places because of, you know, the small amount of bad things happening. So I think we're trying to over-control a situation where education could definitely be at play here. So I don't support the 1,000-foot setbacks from Children's Hospital or the one on 1 street.
Okay.
Or the specific portions. I feel like that's really cherry picking.
Thanks. Because we're the second round, Heidi, it's too much, so thanks. We'll go with Councilmember Jezierski.
Thank you, Mayor. I just want to clarify, my proposal is would not relegate marijuana shops to the dark corners of Broomfield. It's much more specific and surgical than that. I mean, it's really some of the box store plazas in our community, you know, where a lot of families go and visit. My proposal would leave probably hundreds of locations available in the Broomfield area, including those along a lot of our major roadways. So that's why I just make sure everyone's clear, you know, wherever it goes, that it's not being defined correctly. This is a surgical approach. It's not relegated to the corners. There are plenty of other opportunities available. These are some very specific areas that I think are important areas to control. That's all.
Councilmember Groom.
Very valid point. I agree in regards to the terminology I used. What I really need is a map and it updated to see a lot of things we talked about tonight. And I do want to reiterate one of the things that Councilmember Law Evans said, which is I'm not quite sure we're fully bright to push this through, considering all of the amendments that we're looking at tonight. And that was our first one that we wanted to discuss. So I think there's just way too many questions and open answers. And this might want to go back to a study session to have open dialogue on all these remaining issues.
Okay.
A lot of things are left for discussion. Thank you.
Okay, so I'm going to go ahead and move forward and go through the amendments for location right now. You know, and then we'll try to, for the sake of time, try to group the other 3 together, just so we don't have well, we just don't have time after 11 o'clock. So I'm going to go ahead and I'm going to go through the list that's in front of us and ask Councilmember Hengel, do you still want to make your amendment? And I presume you have the wording. So you want to go ahead and make that motion now?
Yes, please. And let me get to it really quickly.
It's up on the screen.
Oh, well, that helps. I already had it copied. Thank you. I move, oh, I actually had some more better language, I guess. So I just move to match liquor store setbacks to amend section 5-42090C to remove the residential setback by deleting section 5-42090C1 and 2. Did I do that correctly?
I guess I'll ask you, Nancy, you know, so what you put up in front of us is the liquor store setbacks?
Yeah, in liquor stores, we don't have a residential setback.
Okay.
So it's the same thing as liquor. It's the same thing.
Okay, so everybody gets to the motion. Is there Mayor Pro Tem, are you going to second it?
Yes, Mayor, second.
Okay. Is there any discussion on this proposed amendment? And we're voting now only on the amendment? Councilmember Schaaf.
Yeah, thank you, Mayor. I was encouraged by one of my fellow council members to encourage dialogue for these amendments. So this is one that I'm really uncomfortable with. I think that our community is willing to kind of step out and into this unknown territory a little bit. And I think that removing the residential setback may be too uncomfortable for too many residents, and I would like to keep that residential setback.
Okay, thank you. I'm going to go ahead and call the roll.
Jaworski,
No.
Evans,
No.
Lim,
No.
Lindstedt,
Yes.
Schaaf,
No.
Tessier,
Yes.
Anderson,
No.
Castriata,
Yes.
Groom,
No.
Hinkle.
Yes.
So I have it fails 6-4. Is that correct?
That is correct.
Okay, so it fails 6-4. So we'll move to Councilmember Jaworski, your amendment, if you want to go ahead and make your proposed amendment.
Thank you. I will. I move to amend section 5-42-090C to add a new subsection 6 to limit marijuana stores on certain roadways within the community. And this would read, no licenses premises or licensed premises shall be located within, and we'll have a few locations here. The first one will be 500 feet of the right-of-way of the northern portion of 120th Avenue between Lowell Boulevard and Main Street. I'm also going to do 500 feet of the right-of-way on East Midway Boulevard between Highway 287 and Laurel Street. It would be 500 feet of the right-of-way on the northern portion of 136th between Zuni and Huron, and 500 feet of the right-of-way of the southern portion of 144th between Lowell and Sheridan.
Nancy, I don't know if you're tracking that. Is that then, because
It's different than what was on there, yeah. I've revised it, so it's basically the
So let's get those
stretch of-
revisions, yeah.
stretch of 120th from Lowell to the Civic Center, the stretch on Midway from 287 to the
Here,
basically
slow
to the Girl
down,
Scout
slow
shelter.
down,
Sorry.
Stan, because she needs to capture it, because what you
Okay.
said was,
Councilmember Jaworski, if you have that typed, if you could email it to me real quick and we could put it in the slide and get it on the screen? If
I don't
that's
have it
possible. If
typed.
not-
I
He
have
doesn't
it,
have it
I
typed.
have it in
So-
handwritten notes.
so go ahead, and she, because we need to capture it.
Okay, so it's 120th is it's just the 500 feet of the north side of 120th between Lowell and Main Street.
Got it. North side. North side of 120th between
Right.
Lowell and Main Street. Okay.
And for those that are listening in, again, that's basically from Lowell to the Civic Center. And then the second was on West Midway Boulevard.
Midway.
Excuse me, East Midway. Get that back. East Midway. I'm sorry. East Midway. East Midway Boulevard. It's between Highway 287 and Laurel Street. And for those, that's just basically to where the Girl Scout shelter is.
Wouldn't that be West Midway, or as Midway could go west of,
I think it's West Midway when you cross 287.
okay.
I believe it's East Midway from 287 going east. So this
No.
is the eastern portion of it from 287.
He wants to leave East Midway.
Yeah, it should be Eastman.
There you
right?
go.
Okay. The third one, which may or may not be necessary, was the northern portion of 136th between Zuni and Huron. And that just captures the King Soopers Plaza next to Legacy. So just the northern side of 136 between Zuni and Huron.
Take out the E on Zuni.
Thank you.
And I think both the B and C, to be accurate, should be the 500 feet of the right of way on the northern side. So I don't know if you want to have that. Should be the 500.
Are every one of these 500 feet? Could we just put that at the top? Okay, she's typing in the 500
Okay,
feet.
whatever is easiest. I mean, I think if we all get the gist of what I'm proposing.
Well, we need more than the gist if we're going to vote on it. So.
Well, I thought I was pretty specific on it. This is being recorded, right?
Yeah.
Okay.
And the final one was the 500 feet of the southern section of 144th from Lowell to Sheridan.
Southern portion of the 144th between Lowell and Sheridan.
Correct. And that encompasses the Safeway Plaza.
And the rest of them can be deleted?
Right, so it's just those 4 locations.
Stan, does that capture what you want?
Yes.
Okay. So so is there a second? Okay, Councilmember Law Evans.
Second.
Okay, is there any discussion? So I'm gonna go ahead and have the clerk call the roll on the motion that's on the screen. By Councilmember.
Yes.
Sorry.
Wait. We had comments. We've been raising our hand.
Oh, I'm sorry. Councilmember Henkel. Snooze, you lose. No.
Kim, were you up first before me though?
What's that?
I'm fine. You can go ahead. I was trying to get attention.
Yeah, just really quickly, I've been talking with developers, in certain areas and talking about retail, and like even Garrett talking about the Sun Cap area. And he says the only way retail can survive up here is if I have some anchor stores. So he talks about, it'd be great if we had like a bigger store here so that we can have the retail. So if we're going to be, putting marijuana stores, which are retail, the only way that they're going to survive is if they have those anchor spots. So if they go to King Soopers, they're going to want that foot traffic as a developer going from King Soopers to the marijuana stores and other retail places. But if we're really limiting, I noticed we hear a lot of the words plaza. I want to eliminate it here where there's this King Soopers there. We want to eliminate it where there's a Safeway there. I feel like this really unfairly targets places where retail actually really thrives. So just from a developer's perspective, if I were a developer, I would be really pushing back on that. Thank you.
Councilmember Groom.
Yeah, I was wondering if I could just have another 60 seconds to look at this. It's the first time, and I'm trying to wrap my head around the location without having a map. And I didn't know, I was going to ask if somebody had a map with these circled, but I'm assuming the answer is no. So I think if we could just have a little bit more time to look at this and draw a picture in my head of where these belong, that would be great. We went quite quickly on this.
Okay, so after Councilmember Schaffer, other comments, go ahead and study right now. We'll have Councilmember Schaffer.
Okay,
and
yeah.
And then I'll pause a couple minutes.
Thank you, Mayor. So I just want to clarify letter B. That has I think some old verbiage in there as well. So it says the right-of-way East Midway Boulevard between 287 and Laurel Street, but then it also has Way Boulevard and Miramonte Boulevard. So thank you. That needed to be removed. And so I did pull up the map for this. Based upon those 4 locations, this would mean that the locations over at 136 in Zunai, which I don't think are going to end up being permitted locations anyway, due to the setback from the residential in Westminster. So I think that those go away anyway. It removes the locations there at 144th in the Safeway Shopping Center. At least that's what it sounds like. And then it also removes the locations that are on the east side of 287 in the Garden Center Plaza. And then it also removes much of the many of the locations that are there on 120th as well. So I think that this is kind of, as I stated in my comments, I think that I would like standards that apply to the entire city, and I just don't see this doing that. So I'm not going to be in favor of this amendment.
Hey, Kim, or Councilmember Grimm, I'll pause for a minute. I think your comments, just give council a chance to read it on the screen, and then I'll call the roll in a minute. And we'll adjust it while we're doing it. And Stan, as she's making adjustments, would you make sure that this reflects what you wanted? Because
think so.
okay, I'm going to go ahead and I'll say it slowly. I will call the roll.
Slowly. Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
No.
Schaff,
No.
Tessier,
No.
Anderson,
Yes.
Castriata,
No.
Broom,
No.
Hinkle,
Councilmember
Hinkle,
She got booted off. She's trying to re-log in right now. She just texted me. Her computer crashed. Yeah, I know.
You snooze, you lose, right, Mayor?
Great timing.
Gotta apply the rules uniformly.
Good, she's on.
Mayor, she's back.
Okay, Councilmember Hinkle.
Hinkle,
Sorry, I just got on. Are we voting?
Yeah, this is a vote. This is a vote on Stan's, a proposed amendment on the corridors and so yes or no?
No.
Jaworski,
Yes.
Okay, and I have that then failing 6-4.
correct.
Okay, so then we'll go to We'll go to no more than one marijuana store on any given street. Councilmember Lim?
Okay, I move to amend section 5-42-90 C to add a new subsection 6 that there shall be no more than one licensed premise located on any given street within the city.
Okay. Is there a second? Councilmember Anderson?
Second.
Okay, is there any discussion? Councilmember Livens, did you want to discuss?
Well, yes, I have a question now that I look at this in text. What is the definition of street? Named street? Block within a street? What's the definition of street?
Did you want me to address that, Mayor? Or?
Yes.
Street is a name street. There's another 4 licensed premises shall be no less than 1,000. Well, no, that's not right. It's 5. Licensed premises shall be no less than 1,000 feet from any other licensed premises. That handles around the block kind of thing, you know, that maybe that I'm thinking that you're referring to. But this is on no more than one licensed premise located on a given named street.
So for example, if I understand you correctly, Councilmember Lim, 120th, there would only be one allowed on 120th or one allowed on Midway or what have you.
Or one allowed on Highway 7, yes. Yes.
I don't want to split hairs, but I'm just trying to understand. How about like East Midway versus West Midway? Is that your intent, that one be allowed on East Midway, one on West Midway, or one on Midway?
The Access Live event is in music hold. Music hold ended.
My intent is to use the core, what do I call it? The core name of the street, and not use the east or west qualifier as delineating a different street. Does that answer your question?
Yes, it does. Thank you very much.
Okay.
Any other discussion? Will the clerk please call the roll?
Lim,
Yes.
Lindstedt,
No.
Schaaf.
Yes.
You say, I apologize. You said yes. Yes, okay. Tessier,
No.
Anderson,
Yes.
Castriata,
No.
Broom,
Yes.
Hinkle,
No.
Jezerski,
Yes.
Law Evans.
Yes.
So is that 5-5?
That is 6-4.
Okay, you have 6-4. So I misheard some. So 6-4 in favor.
Yes.
So that passes 6-4. We will move on then to the 1,000-foot setback from hospitals. Councilmember Anderson.
Thank you. And I did receive information from Ms. Rogers that I can actually be very specific to a hospital for children or children's hospital. I'm thinking maybe hospital for children, just in case there was ever a name change, I suppose. And I know that there is some concern about just more restrictions here, but I do want to repeat that Lafayette has a 1,000 foot setbacks from hospitals, and we've had a lot of people that want us to just not reinvent the wheel and follow other regulations that are existing. They have 500 feet from residential, 1,000 feet from hospitals. We're going less, and we're continuing to go less here. And also Aurora has a 500 foot setback from hospitals. So I will go down to 250 feet, just simply to get something where we don't have a marijuana shop next to a hospital. Not everybody agrees with it. And there's also for those patients that are actually at the hospital who maybe need to go out and get marijuana, there is no guarantee that there is going to be a marijuana shop next to a hospital anyways, or within 500 feet or a mile or 2 miles. So that's not really going to change that at all. And I do understand the point on the votes. This is a relatively new area of Broomfield. There is not a lot of history in the votes. And this vote was actually whether or not to tax marijuana. It does not show whether or not the people nearby were in favor of making it eliminate their moratorium, and it also doesn't show whether they are concerned about setbacks or not. So I'm going to still go forward with this, and I'll make it a 250 foot setback from hospitals for children. And I might need Nancy's help with this because I am amending section 542-090, but I think we have to add number 6. I don't know, it's on the screen here. Because would it be 6 then? A licensed premises shall be no less than 250 feet from any hospital for children?
Well, Councilmember Anderson, I thought you wanted to add it to sub 3, where it's 1,000 feet from any public or private school through 12th grade and from a children's hospital. You have a couple options. We do have a new 6, so this would be 7.
Let me see 7. I think there was great concern over it being 1,000 feet, and this would simply preclude just the parcel adjacent to either side of it. It would not be an incredible burden. It would eliminate like 2 parcels.
So let me clarify, how many feet are we going from the hospital?
250 feet.
So I would suggest a new sub 7, since Councilmember Lim's amendment that passed became new sub 6. This would be new sub 7. That would say licensed premises shall be no less than 250 feet from a children's hospital.
All right, that is good.
Okay, Councilmember Anderson, does that capture what your motion is?
Yes.
Okay, Councilmember Hinkle, were you going to second that, or did you want to discuss?
Oh, no, I was not going to second it. I was just going to discuss. I'll let other people second
Okay,
it.
is there a second? Councilmember Law Evans.
Second.
Okay, Councilmember Hinkle for discussion.
So I'm just really puzzled as to what problem we're trying to solve here. There is no problem of marijuana being situated near a hospital. Now, granted, hopefully we don't have children constantly in hospital. And if they are in a hospital, they could actually benefit from cannabis, like I've seen with Ethan. And I'm frustrated at the view of that marijuana is viewed as you pass marijuana, as people look at it and they're like, oh, that's bad. We have to really reduce that stigma, and it helps more people And if we aren't doing that to liquor stores, I honestly, I don't know why we would do this here. I don't think we're solving any problems being presented to us. Thank you.
Okay, any other comments? I'm gonna call the roll.
Lindstedt,
No.
Schaaf,
No.
Tessier,
No.
Anderson,
Yes.
Castriata,
No.
Broom,
No.
Hinkle,
No.
Jezierski,
Sorry, yes.
Law Evans,
Yes.
Lim.
Yes.
So that fails 6-4.
That is correct.
Okay, it fails 6-4. So that finishes the location amendments. Let me take a read, I guess, of council right now. We have three things addition for tonight. City manager, we need to make it through all these motions. What I want to do is include the operational selections license, have one more round like we did before, where we talk about those all three together, all three sets of amendments together, and then having a vote similar to what we're doing here, where we go through each amendment. That's going to take at least an hour. It's going to take us to 11 o'clock. Is my impression. City Manager Hoffman absolutely wants to get the P&Z, which I believe is second reading, approved tonight, or we're going to get set back in our schedules. I'm pretty sure that Mr. Schaaf wants to have a fairly quick conversation on the, and then likewise, I presume that Kim wants to do it. So I'm going to suggest that that council at this point in time, if we go past 11, suspends the 11 o'clock time, so we can go through all the items of business, because we do not have a business meeting next week. In fact, the only meeting next week is an executive session. So I'm going to ask council if, and I guess I have Law Evans, if council's willing to suspend the hours for tonight. Councilmember Law Evans.
Thank you, Mayor. I have a very early morning tomorrow. I can't go past 11 o'clock or I'll turn into a pumpkin. But I would respectfully suggest again that given the discussions concerning these amendments, that maybe we're premature. Maybe we need to go back to study session on this. Thank you.
Council, I'll ask council, are you want to go, past 11 o'clock tonight? I have Kim saying no, and I have Stan saying no. Councilmember Tessier?
I will not be available.
Okay, let's try to make it, well, I mean, I guess what we'll do is they'll take a read at 11 o'clock, see how many people are available, so we can talk about, because if we lose enough, then there's no sense to talk about Councilmember Schaaf's proposal, because it needs 2/3 vote. And so I guess what I'm gonna do is let's get through these tonight. I think the reason why we're having this right now is that we weren't giving direction to staff. Frankly, there's nothing more like giving direction to staff than voting on these things, is my personal impression. And so we'd have 2 or 3 more study sessions if we didn't have votes like this. And I think, Councilmember Law Evans, that you were the one who called me on having a vote in a study session. So let's get through these amendments, and then I'll take a read of council in an hour to see how many people are still on the line. We may not have enough. So let's go ahead. So the next deal is a round of discussion where the council member that's supporting the amendment go ahead and makes their discussion, makes their, in their 5-minute comments, they make their plea for their amendment. And then, like I said, let's include all the operational selection and licenses one, and we'll reset the clock at 5 minutes for everybody. And so go ahead. Who wants to take the lead? Mayor Pro Tem.
Thank you, Mayor. And I do agree there's a lot of amendments, but both of my amendments are for things that were included in the draft regs without official council approval. So I believe they shouldn't have been in the regs in the first place. Council originally agreed up to a maximum of 5 licenses when we were discussing the ballot measure last summer. There was internal pressure to limit it to 2 licenses to start, so council relented despite the loss of revenue. Let's not forget the other costly mistake on the cannabis tax ballot measure, which also has potential revenue impacts. So my first amendment is about the merit-based system that council gave clear direction in favor of. Now, because we agreed to limit the number of licenses to just 2, staff came up with the idea to include a lottery merit-based combo in the draft regulations, a system not utilized anywhere else in the state and was not recommended by or voted on by this council. Longmont's merit-based system worked great and there was no litigation. My second amendment is about the 24-month waiting period until we can take another license. After agreeing to the reduction in licenses from 5 to 2 to start, I asked that we have an automatic mechanism in place to add additional licenses automatically the following year. That means the next year after. The draft regs somehow include a 24-month or 2-year waiting period, which is double what I requested, and purely staff's idea, which was not vetted with council before adding it to the draft regulations. This also leaves a lot of tax revenue going to neighboring communities. So those are my two amendments. Do I need to also comment on the others, or is that good?
What was your question?
I said those are my 2 amendments. Do you
Okay.
need to comment on the others, or?
If you want to go ahead and provide comments on the others if you want to right now, because you're in your 5-minute period.
I could possibly be in favor of the storage in the safe for operational. I'm not going to remove the delivery option. And well, obviously I support removing the lottery. I support increasing the licenses from 2 to a greater number. And I obviously support the original 12-month request, 1 year until we can add additional licenses. Thank you, Mayor.
Thank you. Councilmember Tessier.
Okay, so just a clarifying question, Mr. Mayor, when you said we're going to go through this, we're going through it operational, selection, and licenses, not just
Correct.
operational? Okay.
Correct.
So I'll start at operational. I think if I'm not in favor of removing the delivery option. Additional requirements for delivery if amendment, no, to be consistent. Oh, I see. I'm not too tied. I'll see what other members say. With the selection, I want to remove the lottery. I think that's appropriate. And with the licenses, I would like to actually make an amendment, but I guess I'll have to wait till that time. Because
Yeah,
I would like
I'll call upon you to make the amendment when it's time.
Okay, so I'd like to go back to the original 5 licenses for the multiple reasons we talked about tonight: transparency in financials, as well as just the workload and efficiency for staff and the retailers. And I'm fine with 12 months rather than 24 months. And just to clarify, I think there was some confusion and a lot of discussion around 12 to 24 months. So there could be some confusion from where staff may have, I don't think council was very clear on a lot. So having some grace with what staff brought forward I'll just wanted to say that. So did you get enough direction from me?
Yeah, and you'll get a chance to make, you're influencing the other council members too in their decisions. So Councilmember Anderson.
Thank you. I will provide some background on the 2 requests, the 2 amendment requests. For the first one is the request that we actually prohibit delivery as we begin this. And Broomfield is new to retail marijuana, and no other city or county in Colorado currently offers delivery of marijuana. So there's no established successful track record from any other municipality for for marijuana delivery. And so I would just like to first propose that we prohibit marijuana delivery at this time, and this could be brought forward at a later date. And if that does not pass, then I will be bringing forward a different amendment that we actually, that if we're not going to prohibit the marijuana delivery in Broomfield, that we actually include the recommendations from our very own Broomfield Police Department, who will be enforcing these regulations. And I think the language here includes, I'll quickly go through this because it's not on the screen right now, but this would include for every transaction, delivery drivers must use a personal video device to document the transfer. They must shut off, lock, and secure their vehicle. Utilize secure locations inside for the product and money. Have a valid Colorado driver's license, a Colorado Med employee license, and a state background check. That they have specific insurance, and that all drivers must be trained on and utilize protocols for events that could occur during delivery, such as vehicle accidents or other events that may cause the driver to leave the vehicle for a longer period than intended for the delivery. And I am willing to, if that is, if there's anything that's not agreeable in there, to modify that. But at a minimum, we should be respecting the wishes of our Broomfield Police Department and add the recommendations. And as far as the other, now I lost it here, but I'm not sure where I stand on the lottery. I could go up on the license. I think Councilmember Lindstedt had noted maybe we could do 3 and then go to 5. I think jumping to 5 right away is a little too much too soon. And yeah, I'm not clear on that 12 to 24 months. So that is my comments. Thank you.
Thank you, Councilmember Henkel.
Thank you, Mayor, and thank you, whoever is putting the slides back up again. I needed it. So I could support, I saw the storage units on Friday when I took a tour of a dispensary to store it overnight. I felt like that was really safe for all involved. Now that we can only have a store on one street, if you're all down 120th, that one street can only have one store. So I am definitely for the delivery option. And I just want to push back a little bit on Councilmember Anderson's thoughts on delivering, because Boulder, Aurora, and Longmont all have delivery services. And then Denver is also going to start theirs too. And additional requirements for delivery, I can support our Broomfield PD because there's the ones that are probably, have those constraints. So I do support our Broomfield Police Department. I am not in favor of the lottery because there's just a lot left up to, we'll get whoever we get. I think with a merit, we get who we want. And I think that that's going to be very important to have as part of our merit system. So I fully support a full merit system only. I would love to see an increase in licenses, even up to 5 licenses, and the 12 months. And I think that's it. Thank you.
Councilmember Groom.
Thank you. I'm just surprised that the cash and the vault is not in the state requirement. So I definitely would support that. I'm in support of removing the delivery option for sure. And I'm also in agreement with Councilmember Anderson that if that fails, to add the Broomfield Police Department recommendations. And then removal of the lottery. I'm in agreement that the merit-based is where we pick the people we want to do business with and who we want in our community. With the license, I did have a question associated with the new information that we had. I just wanted a clarity. I heard 3 or more. That means we need to have 3 or more than 3, Ms. Ritchie, in order to report marijuana revenue?
It would be 3 or more, and that no single business would be greater than 80% of the total sales.
Okay, 3 or more. And then I just had a question. I know that one discussion that we had, and the reason why staff was recommending 2 is just because of the load of getting the regulations out and rolling the stores out in year 1. Is 5 too much? Should we go? I would recommend 3 because I definitely want marijuana revenue sales reported and tracked independently. Could we go to 3 without putting a stress on staff? Can we get, if we went from 2 to 3, we could get the revenue sales? Would that be a significant impact to staff?
Nancy, we can't hear you.
I'm sorry, Member Groom, we're unmuting. Staff is prepared to handle whatever number of licenses that council approves tonight.
Okay, so the discussion previously about not going to 5 because it would stress staff to go to 5 on the first year?
Well, having a new licensing scheme for any business, especially a highly regulated business like marijuana, it is going to add work for staff. We recognize it. But this is the type of discussion that I think council needs to have. Yeah, there's going to be challenges and concerns. There's going to be some efficiencies having, sometimes you say, what's the difference between 2 and 5? We're going to have to do the work anyways, like we mentioned with the application. So right now, staff's position as I'm sitting here near Jennifer is whatever number council approves, we will make it work.
Well, let me caveat that. You'll make it work without additional staff and without reducing a service of something else, right? Like, I don't want to hear yes. I just want to hear, I don't want to come back with, we need more staff to support this extremity. That's what I'm asking.
Right, and I can't make that promise to you. It's very likely, especially as we come out of COVID, that this will require an add-on for staff.
Okay, so I'll be supporting the 3 stores at a minimum because I don't want, at this point in time, to add additional staff to support this. I think getting the revenue reported is important, but not adding additional staff to have the 5 stores is that important right now for Broomfield. And then
Councilmember Groom, if I may just quickly, just again from a managing expectations perspective, to think I am not comfortable or confident saying that as we move through this process that we're not going to have to add staff. Existing staff with what we have on our plates right now, we're tapped. So this additional review from the front end, as well as we regulate it through the process, I don't have a good sense of the staffing that's going to be required, but staffing is going to be required.
So it's, let's call it March, and this is going to happen in a couple months. So how are you going to staff for this that rolls out in midsummer timeframe?
I think
if we're not already looking at that impact and staffing for it right now.
I think from the perspective of the original conversations being 2 stores versus the 5 stores, as well as some of the other pieces from legal's perspective on whether it mirrors when we do the application review process, when we do the review, the security, all of those other caveats. One of the benefits is given that the municipalities and counties around us, there's folks out there that we can tap into that do have this level of expertise. So staffing up, I'm not super concerned about for the longevity, Councilmember Groom. So even though the process begins April, May, June timeframe, that's really when the applications will come in, when the deliberation begins, when the review process and the matrix. So the ongoing work really it will be third quarter, fourth quarter of 2021, and that's when we'll add staff.
Okay, so I'm just going to add another amendment, but I'll talk about that when we get down to other, because that would be additional expenses that I guess I guess that should be disclosed expenses as we're talking through this, but I get it. So I'm gonna stick with 3 stores in year 1. I don't see staffing for 5 stores, but I definitely want reporting on in year 1 of revenue. Thank you, Mayor.
Thanks, Kim, or Councilmember Groom. Councilmember Lim?
Yes. Let's see. The first operational amendment is one that I proposed to have the marijuana products like cash stored in a vault or safe when the shop is closed. So there's language that goes into 2 sections to reflect that, but that seems pretty self-explanatory. It's meant to deter unlawful entry after hours. The products should be as secure as the cash, so that it doesn't fall into the wrong hands, would be the thought behind that amendment. Yes, I support the removal of the delivery option because I have not heard that there are other municipalities that have much experience with this, where they have found out if their own regulations, the state regulations, or their lack of local regulations are doing an adequate job or not. I'd rather give that a little more time for other people to experience, and then we can learn from them. I would support the additional requirements for delivery that are recommended by the Broomfield Police Department. I'm with the removal of the lottery from the merit lottery hybrid. My hesitation there is the merit part is still strong in the merit lottery hybrid. And I'm concerned that sole merit process could look biased, and that the lottery piece adds something to it. Those are my thoughts at the moment. I'll wait and see what else other council members say. I am not willing to increase the licenses to 5. I might listen to my other council members in amending it to 3. I am willing to cut the rollout to 12 months versus 24 months. I think I covered everything. Thanks.
Okay, Councilmember Lindstedt?
Thank you, Mayor. I guess I'll go through the operational ones here first. To Councilmember Lim's amendment about vaults and safes, I guess my one question and thought, I think this is a fine amendment, but I think maybe we need to tool the language a little bit. When I was working in the state legislature, I toured a lot of these dispensaries, and there were a lot of refrigerated goods, and there were a lot of dispensaries that had shelves that had like pullover lockups. So when they closed the store, they didn't have to move everything into a safe. They pulled down a sheet of metal or like a garage door or something like this over the shelves themselves and locked them. So I think you might need to make sure that maybe things like that are considered a safe, and maybe, a locked refrigerator or freezer is considered a safe. I don't know what the definitions are, but I think it might be important to make sure those two things are included, but also I would support it if we can fix the language a little bit. With the removal delivery, I oppose that, but I do support the PD amendment. The lottery, we had a big discussion last study session on this. I fought hard against it. Afterwards, I had a long discussion with staff. I support removing the lottery, but I do feel confident if it remains that it will be, utilized in a limited way where only the very best applicants end up in it. So I'm a little softer on this than I used to be, but I do support removing it. The licenses, I would prefer 5, but if we can't do 5, 3 and 2 is okay. I just don't want us to be doing a whole process for one license. That just seems like such a huge waste of staff and resources to do a whole application process for one license. So I think that's everything there. Thanks, Mayor.
Other comments before I start asking for amendments? I'm going to go ahead and I'm going to go ahead and ask Councilmember Lim for your amendment.
Okay. I move to amend section, sorry. Oh no, I lost my place, sorry. I move to amend section 5442-100A 2H4 by changing the language as follows. The licensee's plan to prevent theft or the diversion of marijuana, including maintaining all marijuana in a secure locked room that is accessible only to authorized persons, and when the business is closed to the public, in a safe or vault. And also to amend Section 542-250E, secured storage. All marijuana establishments must install a safe or vault for storage of cash on the premises, and a separate safe or vault for storage of marijuana on the premises when the business is closed to the public. The safes or vaults must be incorporated into the building structure or secured to the structure in such a manner as to prevent removal.
Is there a second? Councilmember Anderson?
Second.
Any discussion? Councilmember Tessier?
Yeah, I just had a question. If Councilmember Lim is amenable to what Councilmember Lindstedt brought up, where the like metal door is considered a safe. And if it's been proven throughout the region that it's actually safe, and it doesn't necessarily have to be in a block safe or a vault that we typically have seen in the past, but could be like a divergent definition of a safe.
Well, there's in section 542-250E, that secured storage definition, the last sentence says the safes or vaults must be incorporated into the building structure or secured to the structure in such a manner as to prevent removal. So I would think my understanding of what Councilmember Lindstedt is saying about a secured door, is that what I think he was talking about? Or a case that is secured to the floor. I think that might qualify under that language. It would probably be somewhat up to interpretation by those who are looking at the security plan, is what I would anticipate also.
Thank you. I just kind of don't want to limit it and limit my own, like what I envision a safe or a vault to look like, when there could be some really high quality safe and vaults that are part of the structure. I guess it would be up to, like, who decides, who proves that I'm a little confused, so I might need a little more clarification. I'll wait and see if it gets clarified.
Councilmember Anderson, did you want to make a comment?
No, I didn't lower my hand.
Okay, Councilmember Lindstedt, you want to help clarification? Is that what you want to do?
Yeah, I mean, I agree with Councilmember Lim. I think that the bottom portion makes sense. Maybe there should be an as approved by the security, I don't know, professionals' opinion, something like this, to give it a little more looseness in case someone, if you go to a gun store and they have the racks in back, they cover them up with like a door at the end. And, I would just want to make sure something that's a little bit, not a vault is included. And my other question is, would be for legal, would a locked refrigerator be included in this definition? Maybe if it's bolted to the ground, I'm not sure. But there are a lot of refrigerated products that they use.
We have an idea. If you look at the screen, Pat Gilbert is typing in a possible suggestion.
That was the wording I wanted to put in, so for what it's worth.
Equivalent secure
Device.
Structure. Fixture. Right, because fixture is something known in residences and commercial areas. So I think that would, and going to Councilmember Tessier's question, Broomfield is going to be regulating this. Legislative intent matters when we look at how to enforce this. So this discussion is very helpful. So this would be staff's suggestion for addressing, like, the gun vault that Councilmember Lindstedt just mentioned, the other type of secure fixtures that are used in jewelry stores and other type of commercial premises. I guess the question now is for Councilmember Lim, if she would agree to make this a friendly amendment.
Yes, I agree with that addition of that language.
Councilmember Anderson, do you still second?
Second.
Okay. So it's been friendly adjusted. Okay, Councilmember Hinkle, did you want to say something?
Sorry, no, go ahead. No.
Then I'm gonna go ahead and I will call the roll on this one.
Schaaf?
Yes.
Tessier?
Yes.
Anderson?
Yes.
Castriata?
Yes.
Broom?
Yes.
Hinkle?
Yes.
Jezierski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
So it passes unanimously. So let's move on to the next one. Can you go back to the amendment screen? Okay, well, the next is removal of the delivery option. Anderson, do you want to make your motion, your amendment?
Yes, I move to amend the proposed regulations by amending section 542-230 to prohibit marijuana delivery and deleting section 542-100A to J regarding the submission of a delivery operation plan.
Is there a second?
Second, Law Evans.
Law Evans, is there any discussion? I'll go ahead and call the roll.
Tessier?
No.
Anderson?
Yes.
Castriata?
No.
Broom?
Yes.
Hinkle?
This is, just to clarify, this is to remove it. I'm voting yes to remove it,
It's to remove
right?
delivery option.
Okay, yes.
Okay.
Jezierski?
Yes.
Wait, I think I was skipped over.
Was.
Hinkle?
Hinkle, I do not want to remove the delivery option, so no.
Jaworski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
No.
Schaaf.
No.
The count is 5-5.
So the mayor votes no.
That would mean it fails 6-5.
Right, and so then I'll go to Councilmember Anderson for the backup recommendation or amendment.
I move to amend section 542, 230C and D to add the following additional requirements for delivery. And do you want me to read all of these? I suppose.
We don't need to. We have it on the record. It's on the screen as well.
Can you just confirm, Councilmember Anderson, that captures what you want for your amendment?
Yes, I believe so. And there were not any changes to this one from the original language.
There were not. And Councilmember Anderson, if we could just say 1 is a video device, 2 is a secured vehicle when it's not running, 3 are vehicles must have something secure to store marijuana in the car. We have 2, 3, sorry, we'll fix the numbering. Drivers have to have a valid Colorado license and an MED employee license. They have to have insurance of not less than $1 million. And drivers must be trained and utilize protocols for if there's an accident or other situation which takes them away from delivery.
Yes, that is good.
Is there a second? Councilmember Law Evans?
Second.
Is there any discussion? Will the clerk please call the roll?
Anderson,
Yes.
Castriata,
No.
Broom,
Yes.
Hinkle,
Yes.
Jaworski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
No.
Tessier.
Yes.
So it passes 8-2. Let's go on to the removal of the merit, Councilmember or Mayor Pro Tem Castriata.
Thank you, Mayor. I came up quick. I have it right here. I move to amend section 5-42-120C so that additional nope, wrong one. They're in different order. This is the amendment to remove the lottery from the merit-based selection process. Okay. I move to amend these regulations to remove the lottery selection. Specifically, I move to amend section 5-42-150 A, D, and E as follows to provide for a merit-only process. To delete in its entirety section 5-42-160, the lottery process, and to amend section 5-42-070 regarding the city clerk's powers and duties.
Is there a second? Councilmember Hinkle.
Second.
Is there any discussion? Councilmember Hinkle, did you want to discuss or was that for the second?
I do want to discuss just really quickly Just that we were pointing to the Longmont regulations, and Longmont had 0 issues with their merit-based system. And if we really want to tell people this is who we want here in Broomfield, we have to be really intentional. You want good signage, you want the best of the best, this is what you need for merit-based. Thank you.
Councilmember Schaaf.
Yeah, thank you, Mayor. I wasn't going to talk, but I feel I need to. So I'm not in favor of the removal of the lottery, and the reasons why is I'm not as concerned about the potential for lawsuits with going with a merit-based only system, but I am concerned about the potential for potential corruption that could happen with elected officials, as well as the local licensing authority or anybody that has jurisdiction over these licenses. I want to ensure that we have equity among the different applicants, from budding entrepreneurials to big corporations as well, and that they have equity within the system. And a lottery system would more likely, remove those barriers for them. And so lastly, I think that, by going with that merit-based only system, I think the process that I want to see is that we have the highest standards for health, safety, and security for these businesses. Without those high standards, then I am nervous about that lottery system being removed, because at that point we base it on those standards, and if they're not high enough, then we potentially get a business that's just not the greatest fit. So at this point, I am in favor of keeping the lottery system, but I want to see that those standards are high. So that's all I have. Thanks, Mayor.
Any other comments? Councilmember Groom.
Yeah, I too wasn't going to speak, but I decided to. I have to say I was one of those council members, and I do apologize for staff that I was in support of the lotto and then changed my mind, and want to go solely with the merit, because I do think it gives us an opportunity to make a selection. Staff is very similar to selecting a contractor. That's what we've been doing all along, and you guys analyze contracts and you rack and stack and basically do a weighted system and analysis, and you pick the best for Broomfield in that regards. And this merit-based analysis with the criteria that's set aside, I do think that that gives Broomfield the opportunity to select who we want to be doing business in Broomfield, and instead of just putting it up to the lotto to select that. So I am one of those council members that are switching back and forth, and I'm just solely on the lot or on the merit for now, and going to vote favor of removing the lotto. Thank you very much.
Other questions or comments from council? Clerk, please call the roll.
Patriota,
Yes.
Groom,
Yes.
Hinkle,
Yes.
Jezierski,
No.
Law Evans,
No.
Lim,
No.
Lindstedt,
Yes.
Schaaf,
No.
Tessier.
Yes.
She said no. She said yes. Anderson,
No.
It tied.
it's tied.
I already talked to the mayor pro tem about this. I'm going to go with the legal recommendation on this that they came up with and leave the lottery. I mean, so I'm going to vote. I'm going to vote no. So, which means the lottery stays, correct?
Correct. Correct.
Okay. So it fails with the mayor doing the sixth vote. Okay, so let's go to increase in licenses from 2 to a greater number. On the screen I have here, so who's going to be the one to present that? the amendment?
I believe at this point, we have two council members that are interested in this amendment. Both Councilmember Tessier and Councilmember Groom had indicated they'd like to float amendments to increase the number. It sounds to me that the number is different, though.
Yeah. So Councilmember Tessier, I think you were the first one to bring it up. So I'll go ahead and let you propose the amendment.
Sure. Well, after the conversation for tonight, I would be in favor of increasing the number of licenses to 3, and then having 2 more within the next year. So my amendment would be 5-42-120C. The licensing authority is authorized to issue a total of 3 licenses for the purposes of regulating marijuana establishments. 3 licenses at first, and then 2 more within 24 months. That's kind of how I want to state it. Purpose of regulating marijuana establishes subject to the provisions and restrictions provided in this chapter.
Councilmember Tessier, if I can make a suggestion, and please tell me if this is not what you intended. I think we can address the last 2 issues together. So if I heard you right, what I hear you saying is I move to amend 542-120C to authorize the issuance of a total of 3 licenses instead of 2 in the first sentence.
Yep.
And then continuing on to that second sentence in that same section that gets to the other issue that was still on the list, which is additional license up to a total of 5 may be added at a rate of 1 additional license for, did you want to put in 12 months from the date of license there?
Yes.
That's the last issue on the list to be discussed. So we'll change it from 2 to 3 license first year, and then change that 24 months to 12 months. That would be your amendment?
Yes.
Okay.
Yeah, let's finish. Let's get this done because this is pretty critical. So we'll wait a minute for you to get it the way it needs to be done.
I don't know how to get this rolling.
But just retype it.
And then Paul, shift 5.
Oh, there you go. And that's your intent, Councilmember Tessier, that it's 1 additional license per year?
The rate of, I'm sorry, 2 additional licenses within the 12 months. So it would be 5 within, so
1
we get
year.
up to 5, but just 3 to start.
That's what I thought.
Yeah.
So it's really, by adding the license rate, I would just say adding the additional 2 after 12 months or something. I think is what you're saying.
Right.
So, okay, got it. 3 in the first year and 2 within the 12 months after the first license are issued.
Right.
That's how it works. Okay. I think we get it.
For a total of 5 in 24 months.
Oh, yeah,
No,
okay,
12
I can see that. Yeah, I see.
Yeah, total of 5.
So you did have it right. Sorry, folks.
That's right. Yes. So in 2021, we'd be doing 3 licenses, and potentially at the end of, in 2022, we'd be doing another 2 licenses.
Correct.
Right, for a total of 24 months. So I'm sorry if I created more confusion.
No,
You did right. I think
the wording wasn't right.
Yeah, get them all together.
We can put this director in later.
Yeah. But you might want to read 2 and read whatever that you want to change.
Okay.
I don't have my tool. You can bold it. Control bold. Yeah.
Okay. All right. We're good, Mayor, if we want to open up the discussion. I think we need a second.
Yeah. Is there a second? Councilmember Lindstedt.
Second.
Okay. Okay, is there any discussion? Yeah, I just want to make a comment, Councilmember Groom, that, okay, Councilmember Jazierski, go ahead.
And my only comment is that it still reads a little ambiguous to me that you can do a 5 additional license for a total of 8. I don't think that's the way, I don't think that's what's being proposed, but.
Definitely not.
But that's what's, okay. Additional license, it says additional license is up to a total of 5, so to me, it looks like you're talking about 5 additional licenses onto the 3 already approved.
Agreed.
If Sharon, if you, Councilmember Tessier, if you agree to that, we can just also add, taking out that up to a total of 5.
Yeah, I agree with Councilmember Jazierski.
What was that?
Yeah.
But there also needs to be a restriction somewhere. It says a total of 5 overall. So
Yeah.
then if you do 2 a year, then it could be ongoing 2 a year for the, eternity. Right. So there has to be a statement that says a total of 5 overall.
Do we have to say a total of 5? Because wouldn't we just be adding 2 each year? Or just a total of 5 for entire Broomfield? Is that what we're saying?
That is what we're saying. That's how it's being drafted.
Okay.
The rate is a little weird.
We're all getting tired, so maybe we could we clean this a little bit on the second reading, because it isn't reading right.
I think that's very.
We potentially can, Mayor. I want to make sure we have the intent, and the intent that we hear from Councilmember Tessier is 3 initial license, 2 follow-up, and a total of 5 total.
Yeah, I would just say, and 2 additional licenses in the next 12 months, and just be declarative for a total of 5. Yes, delete that.
Delete that, okay, what's your?
I think your suggestion was good, Mayor.
Alt shift 5.
Delete that. Yep, okay. Is that okay? So the motion was made by, I'm losing track. The motion was made by Tessier. Is that motion acceptable?
Yes, sir.
Okay, and then the second was,
It's good.
yeah, okay. Okay, so any additional discussion, Councilmember Groom? Or, well, Groom's, no, Councilmember Law Evans?
So after all that, I'm really confused. What does the language read right now?
Well, let's just stay clear that what I think is being proposed is that initially this time around, we're going to do 3 licenses. I think Councilmember Groom has made a super point. We have got to track marijuana revenue. So,
I understand. That's
and
not what I asked.
There'll be 2 more in the next 12 months after those licenses are issued.
That's not what I asked. My question is, what was the proposal that we started from?
That we would have 2 initially, and then you would add additional ones after 24 months.
Okay, thank you.
Okay, I'm going to go ahead and call the roll.
Broom?
Yes.
Hinkle?
Yes.
Jazierski?
Yes.
Law Evans?
No.
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
Yes.
Tessier?
Yes.
Anderson?
Yes.
Castriata?
Yes.
So that passes 9-1.
That is correct.
Okay, so now we'll go to, are there any other, so that covers all the proposed ones that we had. Are there any other amendments that are being proposed for this evening? Councilmember Groom?
I don't think it's really an amendment, but it is something I want to see at second reading that will accompany the regulations, which is a revenue expense analysis. So now that we have the regulations to the pretty much fully bright, I would like to have staff identify what the expense would be for implementation and maintenance. And then also, now that we know a little bit more about revenue estimating, clean up the revenue estimate and give us a new revenue estimate for marijuana, especially now that we know we're going to do 3 stores year 1 and then up to 5 in year 2 and what that would look like. I'm pretty sure we're going to be revenue positive, but I think also another thing, at least a few of us would like to implement, is a pretty strong health and safety program. So I want to make sure that our labor to implement and maintenance and enforce, as well as our health and safety, does not exceed the revenue estimate.
But you're not making an amendment to this?
No, it's just a request before second reading.
Okay.
We'll work on those numbers, Councilmember Groom.
Okay.
Thanks.
So, you know, I think in my script, okay, so now we're going to move to approve the, we're going to approve the whatever ordinance 2149 as amended. And then, so right now I'll just call the question. Is there any further discussion on, you know, on 2149 as amended this evening? Councilmember Groom, did you want to make an additional comment?
Oh, no, I just didn't lower my hand.
Okay, so I'm going to go ahead and call the roll, and this is the vote for 2149 as amended tonight several times.
Hinkle,
Yes.
Jaworski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
Yes.
Broom.
Yes.
So it passed unanimously? Okay.
Yes.
Yeah, good job, Council. Let me suggest we're at 11 o'clock. We have a session next Tuesday night, the first Monday that the city manager and the attorney have asked us for. It's going to be on reverse setbacks. They anticipated to take 2 hours. It's right now scheduled to be between 6 and 8. It's already been approved by council or authorized by council. What I'm suggesting tonight, and I'm exchanging some text with the mayor pro tem and the city manager, is that we have a special meeting on March 2nd because Jennifer is saying that we need to do the planning and zoning. I want to go ahead and authorize the special meeting. Mayor pro tem, are you going to make that motion or?
I'd be happy to, Mayor. Thank you. I move that we have a special meeting on March, I don't have it written down.
March 2nd.
We have a special meeting for March 2nd to do the P&Z stuff, and then also finish the rest of the agenda.
Okay.
So that would be a special meeting on ordinance 2138, amending certain sections of Title 2, 10, 12, 15, 16, and 17 of the Broomfield Municipal Code regarding development review process and planning and zoning commission.
And then she
First
added
read.
on that, and then do the other, go ahead and do the other items, which includes the ballot or the ranked choice voting, and then the Section 18 request.
And the Section 18.
And at DPM.
Thank you for
Okay.
your help.
And just go ahead, say the obvious, that it follows the executive session, whatever time that is. So,
And it follows the executive session, which is estimated.
Councilmember Tessier, did you, was there a second? I'll ask that.
Second.
Okay. Councilmember Schaaf, or was there any discussion? Councilmember Groom?
Yeah, is that a meeting that we should start at 5?
Yeah, I wanted that too, but can we do that now and go ahead and start the executive session at 5, or is it too late?
We could start it at 5 if council is so inclined.
I would prefer to.
So, yes, staff would prefer to as well. Yes, if that works for council.
I might be late.
Councilmember, Mayor Pro Tem, do you want to, so I guess
Well, I just wanted to say that I know it is a hardship for some of our council members to begin early, and we are allocating 2 hours just for setbacks, reverse setbacks, and then we would have 2 more hours to finish the agenda, which I think the development review should be enough time.
Yeah, I think we can do those then.
I think we could do it in
less
4
than 2
hours.
Oh, yes, yes.
But I don't want to go to 10 o'clock, and I like the idea of 5, so.
Well, I think we should consult with those people who may have a hardship.
Yeah. Can council do 5 o'clock on next Tuesday?
I'm one of those people that has a hardship, and I have to find someone to help me out every time it starts at 5. I'll make it work, but I might be late. Thank you.
Okay, thank you. Although, Councilmember Anderson, you're pretty critical to that reverse setback. Let me just say that. So to the extent, I don't have a kid.
I will. Yeah. I always make it work. So okay. I will.
And I know you do, and I appreciate that. So there's a motion and a second. I'm just gonna, to have the executive session start at 5, and immediately after the executive session, we'll have a special session which will deal with the planning and zoning and the remaining items on our agenda tonight. And Councilmember Tessier said the second, and then that's okay with you, Councilmember Tessier? Okay, so any other discussion? Clerk, please call the roll.
Jezierski,
Yes.
Law Evans,
Yes, and can we order dinner again?
Yes.
Lim,
Somewhere other than 3 margaritas?
Yeah, let's find a way to help so we don't have to do 3 margaritas again. So.
Yes.
Lindstedt,
We're gonna do it.
Yes.
Just gonna do it.
Schaaf,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
Yes.
Broom,
Yes.
Hinkle.
I wonder if we can order from one restaurant in each ward, so me and Guyleen get to share a restaurant. Yes.
Yes. So we have our March 2nd special meeting set, but we're still going to have our session on Monday, right? The planning session, Jennifer, because that's what legal needs it, is what I'm assuming. Why you moved it to Monday? Okay. So council, it is 11 o'clock. I appreciate everybody's efforts tonight. I actually thought the process was a constructive, good process. So thank you, everyone, and we'll see you next Tuesday, if not before.
Night, y'all.
Good night.